Star going.
Yeah. I'm not scared easily, but we're in a weird world, you know, and you're in a public restroom and the lights go out.
Yeah, I was like, why is that?
The brain does go to the worst part.
Yeah. It was not, I was like, it sort of took me like, whoa.
And I watched too much true crime.
Yeah.
I should not do that. I really.
Yeah, my sister listens to those podcasts. I'm like,
You're
no,
self yourself out. I mean, true crime, but
no,
I should not do it.
no, I have.
Then I walked.
Betsy, can you hear us?
Yes.
Yes, I can. Can you hear me?
Yes, we can.
How exciting is it?
She just can't leave Washington County.
Not today, sorry.
There's so much construction along the way, so not as bad.
Yeah. I'm glad we're fixing it. It's all right. Well, we have a quorum. So I am going to call our meeting to order. And just remind people who are here that we've been asked by the people in the building to make sure that we sign in and sign out for safety reasons. So please do that if you can. So the meeting, I just need to share with you, Brendan will not be with us today, he cannot attend. Joe may or may not, most unlikely will not attend. And of course, we have those joining us by Zoom. So the agenda is we will start in a minute with introductions, then we'll have some public comment. We will go over June agenda overview, we'll review the minutes. We'll have a spotlight, Project Dama, for about 15 minutes. We'll go over some FOA requests, the Governor's Opiate Conference, we'll talk about strategic planning a little, school funding, committee reports, HRIA, presentation discussion on the prevention grant, and then staff reports. As you can see, busy meeting, so we will try to be on time and on task, because as you know, we have to leave this building. Our meeting has to end by 4:30, so we can give the staff time to get out of here because this building closes at 5. So I'm gonna start with introductions, and I'll start with those online. Betsy.
Betsy Fitzgerald representing the litigating subdivisions.
Thank you. Liz.
Hi, I'm Liz Blackwell-Moore, she, her pronouns. I'm the Director for Cumberland County Public Health.
Thank you. Jamar.
Good afternoon, Jamal Williams. I am representing prison reentry.
Thank you. I'll go the other way. Deb, I saw the apologies say.
Hello, everyone. My name is Deb Poulin. I am the Acting Deputy Director of the Office of Behavioral Health and the Treasurer for the MRC.
Hi, everyone. Melissa Hackett. I use she, her pronouns. I'm a policy associate with the Maine Children's Alliance, and I serve as the vice chair of the Program and Grants Committee on this county.
Good afternoon, my name is Todd Brack, I'm the chair from Lincoln County.
Hi, I'm Melissa Foyer. I'm the coordinator for the Maine Recovery Council.
Chastity Toole, Executive Director of the Maine Recovery Council.
Hey, can you guys speak up a little bit, please?
We can do that. Pat Kimball,
Thank you.
chair. Thank you.
Maggie McLaughlin, representing litigating subdivisions, vice chair of governance committee.
Hi everyone, I'm Tess Parks. I use she, her pronouns. I'm a person with lived experience of substance use disorder, and I'm the vice chair of the Maine Recovery Council.
Good afternoon, my name is Holly Stover. I represent House District 48, and I am appointed to the council by Speaker Ranfetto.
I'm Paul Vinsel. I'm a physician, recovery medicine and emergency medicine, now retired, and I'm a member of the MRC.
Thank you, everyone. Thank you. So the first 15 minutes of our meeting is public comment, and we have someone here that was going to make some public comment, and I don't believe we have anyone else who's signed up. So I am going to welcome public comment, an old friend of the council, Miles Levesque, who actually served on the first 2 years of the Recovery Council, and is here in regards to share a little bit about his program and the funding. He's one of the grantees, receivers, and where that program is.
Thank you for having me. Again, I'm Miles Willett. I'm someone in long-term recovery, someone who was directly affected by the Big Pharma So I'm blessed to be here today, be alive, first of all. And to have been awarded this grant money and to give back to my community of Aroostook County. So I'm also a licensed alcohol and drug counselor and a clinical supervisor. So it's been about a year and a half. I brought you all like a packet of some sort, just pictures, just to show you folks where the money went and what I've done with it. So about a year and a half ago, as soon as I was awarded the money, I was fired immediately. Good and bad, I guess. Good because it gave me more time to focus on this project. Bad because I had no income. So the last year, since I've received the money, I believe it was May of 2025 when I had gotten started on the project with my own personal funds, and then kind of hit the ground running to build what you see in front of you. So this is an outpatient treatment program, which we're not licensed yet. So this is what we are working towards, which will be one of 15 or 16 in the state of Maine, and only one north of Bangor. So the other 14, there's one east, which is in Washington County, Calais, and then one north in Prescott. And folks were having, so I was a clinical supervisor at the clinic in Presque Isle, and folks were having huge transportation barriers getting to the clinic, wait lists, a lot of reasons why we needed the clinic. So fast forward a year later, I had purchased this old building before opioid settlement funds, and about 5,800 square feet, and transformed it into a clinic. We have, this is the face of the building, the first page. There's a reception, a waiting area. You'll see where there's dosing windows, the nurse's office. We have a lab, doctor's office, 3 counseling offices, group room, break room, my office, and then the clinic director's office. So starting as of this past week and a half, I've been starting with the licensing phase. I still have around $40,000 of opioid settlement funds, but I'm saving that for operating costs, medication when we have to start ordering that, the electronic medical records, that'll kind of come into play. I'm at a little bit of a standstill, working on some grant funding. I don't have a staff, so I'm trying to figure that out. So my goal is January to open. It's about 6 months, depending on how long licensing takes, and depending on finding a staff. At first, I thought the project was not that it was going to be easy, but it was, that it was fairly doable. I've been doing this by myself, so I've completed this myself, and I'm at a point where I can't do anymore. I'm in credit card debt, and I'm like, I gotta get back to work. I gotta figure out life. I knew that if I paid myself a salary with some of these funds, I wouldn't be able to get to where I'm at now. So everything went into this building, into getting this where it is. Project like this is anywhere from $1 million to $1.5 million, and I got to where we were with $500,000, which is kind of amazing. I think it's one of the only OTPs in the state of Maine that is actually owned. It's not leased, so there's no mortgage. It won't be going anywhere anytime soon. So if something happens with Maine Care or with insurance, you're not going to see a business up and leaving a community. It is there to stay. That's pretty much it in a nutshell. Any questions?
What else have you? looked into partnering with other OTPs? Or have you looked into opiate settlement funds from the counties or other sources?
Yeah, so I'll touch on both of those. I did receive $50,000 of opioid settlement funds from Lewiston County as well. So excuse me, thank you. And then I received a $13,000 grant during COVID when I first, before this money was available to kind of get, I went into the building to kind of winterize it the first year I bought it. In terms of partnering, I've talked to a few folks. There's 3 companies in the state of Maine. One of the reasons why I opened this clinic is because I don't want to be corporate. I don't want to, I don't want to talk bad about anybody, but I found the corporate world, I just wasn't a fan. We weren't patient-centric. We were saying we were, but we weren't. We had 125 people on our caseload, and we're only licensed for 50. And it's not for lack of not hiring folks. Folks could have been hired. It is what it is. Some of these places give bonuses for the longer we keep people on medication and things like that. I want to stay away from. So I don't want to partner with. Now not all the companies in the state of Maine are corporate, so I don't want to. There's one company who's been amazing, helping me through this process a little bit. Opening up their home basically to show me how things work and how to go about applying for licenses and licensure. So I have been working with one of those companies. I say working with, but they've been guiding me. But where I'm at now is just I need to hire a clinic director. I need someone to help me to move forward. When I originally applied for funds, my budget was $750,000, and that was on the low end. And I was awarded $500,000, which is amazing, and I'm grateful, super grateful. I didn't want to say no to the funding. I knew it was going to be short, but I wanted to at least show you folks what I could do with this money and get a clinic built and have it there before maybe moving forward with another request or with looking for other grants. There's an RCorp grant that just opened up, which I'll be applying for. And then there's another grant coming up in the next few months that I'll be applying for. So I'm hoping those pan out, but I'm not sure. In the meantime, personal life versus professional, I've got a child, I got child support, I've got to work, and I have not worked. A little bit difficult too, finding a job as a counselor who's opening their own practice in a 6-month span. And I'm transparent with these folks, so it's, I don't want to tell them, hey, I want to come work for you, and then 6 months I'm going to be out the door. So it's a little bit of a, it's a little bit of a catch-22. So at this point, like I said, I'm just trying to navigate the licensing process, but I need an extra set of hands. Most corporations, most companies have a team of 5 to 15 people doing a project like this, and I've been by myself, and it's been a learning experience, definitely. I'm grateful, and I think everything has gone, for the most part, pretty smooth. But I'm at a point where I need some help. And that's why I'm here today. I wanted to give you guys an update. I've had a bunch of people calling me, hey, when is the clinic gonna open? Where are you at? What are you doing? And I just want to be as transparent with you folks as possible. I know everybody wants to see this open. I don't want to see it fail, and I'm not saying it's going to. I wanted to let you folks know where I was at.
Thank you very much. Other questions? Thank you very much for your willingness to serve a very underserved part of your state. And certainly I wish members of the council wish you well, and again, the other grant opportunities. Thank you for sharing that with us. And if these are in some sort of easy folder, I know the members that are on the Zoom didn't get these. If you could either send them to Chastity and she can send them on. But it's always nice to see that our money, it looks like a very inviting and warm environment, which is nice for people when they're first entering that door. As you know, it's scary, but thank you very much.
Yeah, we just a heads up too, there is a quarterly report that we have to follow, and there's pictures and updates in there. I don't know how many folks have actually seen it, that's why I wanted to kind of,
Staff.
just
The staff.
there's that. Also, just a heads up, we're gonna be doing EKGs, which is a little something different that other places don't offer. And I guess a question for you folks, and I know now is not the time, so I'm not here to request for funding, but how would that work moving forward?
So we will be discussing within the next couple months about where we are with that first round, that in the second round that we awarded. And at that point, we will look at starting to set dates as to the next round of funding. Whether, again, there is a decision to say, do we continue to fund some programs, or are we gonna put it all out to RFP or not? And that discussion will happen within the next 2 months.
Gotcha.
So the next grant that's going out, and we'll talk about it later, will be prevention. Because as you know, that was pulled separately.
Yep.
So just keep an eye out
Okay.
for it, and that's where we are. But we haven't made a decision yet.
Gotcha. And just last, before I go, this is a sustainable model. And for anybody who wants to know more information about it, I can gladly help you folks. I think it's Deb, right? That's what you do? You cover OTPs, or is that?
Well, Catherine Kutu does within our office, yeah.
Okay.
Yeah.
But it is a sustainable model, so it's, if I can get this up and off the ground, it is not something that I will be coming back to continuously request, or I just wanted to throw that out there. And again, thank you for allowing me to build this for Maine and for Mainers. It's something tangible. It's a program that people can see, and I hope you know where your opioid settlement funds went.
Thank you. Thank you. Any more public comment? There isn't, so we're going to move forward. I am gonna change the agenda just a little. Liz, it has to leave at 3 and has a presentation, so I'm gonna move you up to after the project drama presentation, and move you in there before the chairperson's report. So in there, if that's okay with you, Liz.
That's great. Thank you so much. I appreciate it. Sorry I have to leave early.
Oh, we get it. So the first vote that we have here is for the minutes. You all should have gotten the May minutes that Betsy has so beautifully put together, as usual for us. And I'm looking for a motion, a second, and or any comments or edits. Motion. I hear a motion from Maggie. Second. And Deb seconds. Any other discussion?
Who was the second?
Me, Deb Pooley.
Deb,
Okay, thanks, Deb.
and we will then call roll.
Betsy Fitzgerald,
Yes.
Deb Poulin,
Yes.
Holly Stover,
Yes.
Jamar Williams,
Yes.
Liz Blackwell Moore,
Yes.
Maggie McLaughlin,
Yes.
Melissa Hackett,
Yes.
Pat Kimball,
Yes.
Paul Benzel,
Yes.
Tess Parks,
Yes.
Todd Brackett.
Yes.
Motion carries. Thank you all very much. I always feel a little guilty looking at my phone. The reason I'm looking at my phone is my notes for the agenda are on my phone. I'm not texting.
Text away, Pat, it's fine.
I don't, technology is bad for me. If I text, we probably end up there somewhere. We won't.
You're not driving, so we're okay.
Text or phone also.
Yeah, well, we never know. I'm too old to do any of this. Okay. We are, is Project Drama here?
Yeah.
Yeah, Elizabeth's gonna pull them all over.
Okay, so we're now gonna pull Project Dharma over and welcome back Hina. It's like a home week, two former council people.
Let's try again.
Yeah, bring it in, man.
Want to say yes?
Thanks, Hina.
Hi, everyone.
Hello.
Oh, oh, here we go. Sorry, I have like two different screens.
Well, welcome back, and I'll turn the meeting over to you, Hina. Thank you.
Great. Great. Let me just try to get situated here, try to share some slides. Oops. I think I might just have to send a request to share slides.
Should be good.
Okay. Okay. Can you all see that?
Yeah.
In
Yeah.
like the correct view? Okay, great. Okay. Excellent. Great. Well, I'll get started. And yeah, good afternoon. Thanks for the opportunity to present to you all today. It's good to see some familiar faces. So yeah, for those that don't know me, my name's Kina Thakrar. I'm an infectious disease addiction medicine physician in Portland, and I'm the PI for Project Dharma. So today I'll be presenting on behalf of the Project Dharma team, though we do have some team members on the call today, including Jean Bissett, Anna McConnell, and I can't see everyone on my screen, but also potentially Anna Moore and Erica Meyer. So they'll all be available during the Q&A if folks have any questions for us. So with that, I'll get started because we actually have a lot to cover today. So many of you may already be familiar with this, but for those who aren't, Project Dharma has been a collaboration between Maine Health and community organizations really dedicated to overdose and infection prevention in Maine. We were originally funded with a federal grant from 2022 to 2025, during which we worked on a number of key issues, which included HIV prevention, low barrier infectious disease screening, educating healthcare professionals about overdose infection prevention, harm reduction, and really working with community organizations to increase capacity to deliver services to people who use drugs. And importantly, part of this work since 2022 has been overdose prevention and really establishing Maine's first drug checking program. And we'll talk about drug checking a bit in a couple of slides. It was certainly a steep learning curve for us. In fact, we learned that we'd have to pass legislation in order to do drug checking work in Maine. But thanks to many folks on this call, including Representative La Rochelle and Chastity Toole, among many others, LD 1745 was passed in June of 2023, making drug checking possible for any community program in Maine. So on the right is a photo of some of our team members when this legislation was passed. So we're really proud of that effort. Okay, so just to back up and make sure that we're all on the same page about, what is drug checking. And I'll totally admit this was fairly new to me just a couple of years ago. I learned about this from my ongoing relationships with our community partners, and this is really how drug checking became integrated into our work, is because the community partners are really guiding the goals of the project. So drug checking, for those who aren't familiar, is it essentially identifies the chemical components of a drug sample. There's three primary methods, one which includes test strips that detects the presence or absence of a particular adulterant. There are some limitations in terms of sensitivity potentially, but there's also the second piece of technology, FTIR, which is the acronym, essentially uses infrared spectroscopy analysis, and it allows trained staff to analyze drug samples on site in real time, and results can be available in as little as 15 minutes. So it's pretty incredible. And you can see a picture on the right from one of our colleagues, Nikki at Maine Access Points, who was demonstrating how a sample is prepared for drug checking on the FTIR machine in the community. And the other part of drug checking may involve complementary lab testing, which includes mass spec, LC-Q-TOF, getting into some chemical lingo here. But this is really, considered gold standard given this high, sensitivity, specificity. It involves samples being mailed to external laboratories. The downside, not surprisingly, is that it costs money to do this, and also getting results back can take some time, anywhere from 3 to 8 weeks potentially. And so why do we want to include drug checking in our work? We know that substances such as fentanyl can increase the risk of overdose. We know and it's important to know what's in the drug supply, because, if someone's using a stimulant, for example, didn't realize what's in this, that there was fentanyl in it, they could be at risk for overdose. There's also certain adulterants that increase the risk of wounds like xylazine that you may have heard of, and other adulterants that can cause severe withdrawal symptoms such as medetomidine, in addition to other potential negative outcomes. And I think the really important thing about drug checking to understand is that, why it's important. It provides real-time information to people who use drugs. And this is really what we wanted our MRC funding to be used for. It also provides information to clinicians so that we can do a better job about counseling, addressing potential complications like withdrawal, and it can also assist public health agencies with communication about the unsafe drug supply. Drug checking has been around for a while. It's been shown to increase community knowledge about drug supply and emerging adulterants. And importantly, it empowers people who use drugs to really make informed choices. And the quote on the slide here is from a focus group participant who was speaking about the drug supply. And I think it really illustrates why, having a drug checking program is so important, especially for our state. So just to give an overview of the grant from the MRC, again, we're very grateful that we were awarded the grant under MRC's harm reduction pillar. You can see the details of the grant here, but we wanted to highlight some of the key activities we've been doing since we received grant funding, providing services such as wound care supplies, infection and overdose prevention supplies, and very importantly, drug checking supplies and covering services for our 4 FTIR machines. So with the support from MRC, our community partners have also been able to refer to different services, provide overdose education trainings, and the bulk of the funding has really been used to support our drug checking navigators and also trained drug checking navigators in use of the FTIR. And just to give a little background, so the drug checking navigators are staff that are hired from community organizations, and then they undergo this training to use the FTIR and facilitate drug checking. We've also used a bulk of the funding to support ongoing technical assistance with drug checking. And yeah, I think I'll stop there. So just wanted to highlight our 2 main community partners for the MRC grant, Maine Access Points and Portland Public Health. We're really grateful to be working with them. And I will say it feels like a true collaboration. You can see everyone listed here. And again, Anna McConnell is on the call with us today and will be available in the Q&A, I'm sure, if there's questions. So here is a map of the physical locations of where our 4 FTIR machines are located. One is physically located in Machias, another in Biddeford, one in Portland, and then one will actually be on a mobile unit operated by MAP, which will serve Rumford and Oxford County, other locations around there, and also Lincoln and Saginaw counties. I also wanted to acknowledge our other collaborators, consultants, and other research that's part of this work. So Katie Hill is an absolute rock star. She's a PhD candidate at Yale School of Public Health, has ties to Maine, and led our focus groups here in Maine about drug checking services. She interviewed several community partner clients about their perspectives on what they wanted a drug checking service in Maine to really look like. Brandeis and Colby have provided technical assistance. Brandeis does the on-site trainings for drug checking technicians. So we've sent some of our staff there for training. We worked with external labs for complementary testing, which include University of North Carolina's opioid data lab. So UNC is really a national leader in the drug checking space. That lab is led by Nabarun Dasgupta, who some of you may know. He gave the keynote at the Governor's Opioid Summit last year. He's really internationally known for his work at this point, so we're super lucky to be working with him in his lab. We were also really fortunate to obtain some research funding to support the work in our team. So the MRC funding, I will say, has been absolutely essential for the nuts and bolts of this program. But really, the research funding will help us study the program and, study whether hiring drug checking navigators can help us reduce overdoses, improve secondary outcomes like leakage to care, all of these things. So we really see this work as complementary. And again, we definitely could not have done any of this without the MRC funding. So we're very grateful for that. And as I mentioned, the MRC funding, again, has been really helpful for the nuts and bolts of our program, especially given other funding restrictions we've had. So in the interest of time, I'm not going to read through this whole list, but you can see the range of supplies that we've been able to purchase and distribute as part of this work, as well as the number of individuals that have received services because of the work. So really proud of our community partners for doing all of this work on the ground. So here we have some preliminary data. We're super excited to finally be able to share some of these results for the first time in a public space. So thank you, MRC. So I'll kind of orient you. We wanted to again share these preliminary drug checking results. So if you look at the graph on the left, we've collected about 150 samples since November 2024 through early June of this year. There's a couple of things I just want to point out on the graph. One, you'll notice a spike in the number of samples in January 2025, which is when we were able to start providing samples for folks, providing incentive for folks who are using the drug checking program. You'll also notice that there were no samples collected from November and December, and this is when the Sanford location for a map was told to close. And so we had to move the FTIR machine to Biddeford, get ourselves sorted out during that time. And I think that really speaks to the importance of our community partners when it comes to delivering these types of services, because otherwise people will go without these services and potentially develop some of the complications I mentioned earlier. The other thing I wanted to point out was the other spike in the number of samples in April 2026, which is when we were actually able to hire some additional drug checking navigators. And again, I think this speaks to the importance of their role and how they can facilitate this type of work. And then the bar graph on the right are the types of testing we've been conducting. So not surprisingly, most of our samples have undergone testing with FTIR machines at the local community organizations. Again, this is like the heart of the grant, essentially is doing this FTIR testing. Excuse me, we have sent about 40 samples out for complementary testing to those external labs that I mentioned, UNC and CFSRE, and then a couple samples have documented test strip testing. Okay, so as I mentioned, UNC is really a national leader in this work, and rather than reinventing the wheel, we've been paying attention to UNC's watch list of various adulterants in the drug supply. Excuse me, and I just wanted to add that changes in the drug supply are expected. And so I think that is why community drug checking is so important. But anyway, we briefly just wanted to show what's on the UNC watch list currently. We've already talked a little bit about xylazine, which has been associated with bad wounds, and medetomidine, which has I think become more common in certain locations such as Pennsylvania. In Pennsylvania, actually, it seems that medetomidine is replacing xylazine in a lot of their samples. The good news is it does not cause bad wounds at this point, but it can cause really prolonged severe withdrawal symptoms, which have resulted in complicated hospitalizations for some folks. So again, this is why drug checking is so important. We can really pair the results with education for people who are using drugs and education for clinicians so that they're aware of the supply and, can potentially treat patients for severe withdrawals or whatever the complication may be. For those who may not be familiar with the other substances, just briefly, BTMPS is an industrial chemical that's been added to plastic and adhesive to like stickers and things like that, boats, I think, as well. But it emerged around 2024, I believe, and it's been associated with a variety of symptoms, including cough, also a chemical smell, etc. Carfentanil is fentanyl analog, still around, but in trace amounts. So it's something that UNC is watching carefully, but aren't necessarily in a panic about, and neither are we. But um, uh, we just obviously it's something that folks want to keep an eye on just because it is potent. The next is nitazines, which are synthetic opioids. Some are more potent than others. I think there's a lot of things still being sorted out about nitazines, but the combination of nitazines and fentanyl, for example, can be really sedating. And so that's one of the reasons I think it's on the watch list. And the last substance here, 2-fluoro-2-oxo-PCE, which has a longer chemical name I won't attempt to pronounce here, is essentially a dissociative drug, which could be an adulterant in ketamine, but also North Carolina, they actually found it in drugs sold as fentanyl and was linked to overdoses in that area. So that is why it's also on the watch list. The other trend they're keeping an eye on generally is how people are using and monitoring if people are shifting to smoking. This is particularly important so that community organizations can ensure that they have adequate smoking supplies. Obviously, as an ID doc, I also support this, providing sterile needles and syringes and other equipment is super important for reducing infections like HIV, hepatitis. But if people are also smoking instead of injecting, we need to make sure that they have access to that equipment as well. Okay, so now that we've covered what is being seen nationally, we'll share some preliminary results from our drug checking program here in Maine. So just to orient you to the table, first column is the same things that are listed on the UNC watch list. Second column is the number of samples detected by FTIR. Third column is the number of samples detected by that complementary testing to the external labs. Fourth is essentially the total number of samples. So as you can see, particularly for complementary testing, there were a couple samples that contained BTMPS, the industrial chemical, a couple samples that contained xylazine, not surprisingly, and just a few samples that contained medetomidine. There are, limitations to this data, and just because something is in the supply doesn't mean it's necessarily linked to the outcomes we're seeing. So, this is something that we're sorting out as a team when we review the results every month, talking to our technical assistance partners, and toxicologists, et cetera. I will mention that also, as you can see below, of these 37 samples, about 30% of them were smoked. And we also thought it would be helpful just to show everyone what a visual of what the results for one sample could look like when it's sent for complementary testing. So before the Sanford site was shut down, this was a sample that was sent from Sanford, presumed to be fentanyl and xylazine. But when we received the results from complementary testing, we saw this whole list of major components you can see there on the left, other trace substances, one of which included medetomidine, as you can see. So again, I just think this visual is important because it shows how unsafe the drug supply is. And while drug checking doesn't totally solve the problem of an unsafe drug supply, what we really need is safe supply. They can at least show us what the sample contains, and again, just empower folks who are using drugs to understand what they're using and inform the rest of the community as well. So just briefly moving on from the drug checking results, we also wanted to highlight other accomplishments thanks to the MRC funding. MAPS mobile van was completed this spring. And again, it'll serve Lincoln, Saginaw, and Oxford counties. It'll house that FTIR machine. We're going to do mobile drug checking services, which is so exciting. And also pair that with all the other services that MAP has been doing. So it's really a dream come true. It's like super exciting to see this. And then I also just wanted to briefly mention some of the results from the focus groups that I had mentioned earlier. Katie Hill and team worked really hard to really go out to the different sites, interview people who are using the drugs, get their thoughts on drug checking. In the interest of time, I won't read all the quotes here, but really the general reflections are, people appreciated the drug checking process and they thought the results were helpful. They thought this intervention could potentially help to save lives. And of course, this is what we're going to study more formally too. But as you can see, I think it's going to be really well received. And so looking ahead, I know this is a really quick overview, but we just wanted to give you an idea of what we're planning to do in the year ahead, which is really, continue to support in building our drug checking program, continue to do these trainings and work with our TA partners. And something we're really working on is also how to best communicate drug checking results with people who use drugs, with the community. We just want to be thoughtful in how we communicate the results to folks in Maine. So I think that's it. Apologies if I talked really fast, but there was a lot of stuff to go through. So happy to take questions.
Thank you. That was very interesting. Questions from members of the council. Paul and then Melissa.
Hi, Keena, thank you very much, and hello, it's good to see you.
Hi, good to see you.
2 questions, sorry. The first one is, Sanford's test site was shut down. Was that the same time that they shut down the syringe service program? Like, were they combined? Okay.
Yes.
All right. Second of all, does this work that people bring drug supplies to you for testing, and then those people get the results of that test? Is that correct?
So, yes, essentially that's how it works. It's drug residue essentially. And yeah, so people can drop their samples off. We're actually part of the research we're doing is like, what is the best way to do this? Is it a drop box for folks that can't stay? Is it some other means, like the van, et cetera? But essentially, yes, they drop off the sample and they can stay for the results.
And the question I have on that is, do you have any anecdotal evidence or data that information has changed any behavior in people who use drugs? For instance, has someone said, "Oh, there's metacomedine, I don't want to use it"?
Right. Yeah, no, it's a good question. So our colleagues at Brandeis, Tracy Green and others, and NAB have published on this. So yes, there is definitely evidence to show that drug checking, one, I think importantly, like improves knowledge generally about what's in the drug supply, but it can change behavior. And that's also part of what we're studying, I should say, is how is it going to change behavior? Like, does it stop someone from using alone? Does it maybe change the way that they're going to use the drug? Like, yes, these studies have shown it, but we want to see what it shows in Maine when we do this in a variety of settings, like Portland versus a mobile site versus, brick and mortar, et cetera. So, but yeah, there is good evidence, and Anna and others feel free to to chime in if you want. But.
Good question.
Yeah, and with apologies to the council and folks up on the screen, if this was something that folks would know, this project predates my time on the council. So I'm curious about the geographic coverage and if that was sort of determined by partners and sites that were available versus the mobile unit. I'm just curious about the decision making and what informed where the physical sites are, where the mobile sites are, and the coverage area more generally.
Yeah, definitely. And Anna, feel free to weigh in on this, but we essentially it came down to our community partners and where they operate. It was really that. And we wanted to do the drug checking so that we could cover more ground. We totally recognize that there are parts of Maine where we don't have a brick and mortar site. But all of our programs, community organizations are pretty well connected. And so the goal is to figure out a way to get these organizations to talk together. We only have 4 machines. We're bound by a budget, obviously. But we want to try to figure out a way where we could potentially get, samples from other places in Maine too. But right now we're just trying to get the program up and running and piloted. And, I think ways to expand would be wonderful too.
Thank you. Any other questions? thank you all for joining us today and for the work that you do. It's really nice to hear that the money is, I remember, early on when they said, what is the goal of this committee? And it was to save lives. And that's what you're doing. And so I appreciate that. And nice to see that the opiate settlement funds are going where it was intended to do. So thank you very much for your time with us today. Thank you. It's nice.
Great, thank you. Good to see everyone.
Thank you.
Thank you.
Good to
Bye.
see you.
Great, thank you. So as I said, I'm gonna change the agenda just a little so that we can make sure that Liz has plenty of time to present the school funding work group report and recommendations, and you all should have received that. And it was how you, it's well done, and I need to read. So Liz, floor is yours.
Oh, you can't hear me. All right. Can you hear me now?
Yeah, we can hear you now.
Great. When you share your screen, you just have to adjust yourself then. Great. I can see you again. Well, this is Melissa and I are going to share the stage here. So you all have received the report. I thought I'd just do a little high level overview. You could read it yourself, but I think it's helpful for us to just do a little quick overview of the project and the report and then the recommendations, and offer some time for questions. Folks that were on the committee could not join us today, so I do just want to start by saying Melissa and I were the facilitators. I do not consider myself an expert in this topic, and I feel like if there are super substantive questions that we can't answer, we might want to put it to the committee, to the work group again, to get some of those questions answered from them. So you can see my screen, right?
Yes.
Okay, great. Okay, so an overview. Obviously, we were tasked with coming up with some recommendations for you all to consider on how what priorities the council should have for funding through this school. It's actually school administrative unit funding. We called it school, but we were told very clearly that schools and school administrative units are very different, and so it's SAU funding. So the work group members were obviously Melissa and myself, and then our other participants were a really wide variety of folks who represent different parts of school systems and the state and special education. So Atlee Riley from Disability Rights, Carrie Woodcock is from the Maine Parent Federation, Erin Fraser from the Department of Education, who works specifically on special education and inclusive education, Gay McDonald, who's the executive director of the Maine Administrators of Services for Children with Disabilities. Catherine Haas Katie Haas is from MS-86, and she was the chosen representative by the school administrative units that, if you remember, is in the MOU that the state has around spending the funds. Nancy Cronin from Maine Developmental Disabilities Council, and Sarah Wilkinson, who is a professor of special education and does consulting work in schools. And then supporting the group, of course, was Chastity and Elizabeth and Brendan. So as you know, there's in the Maine Recovery Fund, we must set aside 3% for school administrative units. What that meant at the outset, what we think it meant, was there was currently about 1.25 million. This number may have changed since we started that. The projection was that it would reach about 3.45 million over the lifetime of the settlement funds. And the work group, we did a process that was much like the prevention work group. We started with discussions of the current strengths and challenges faced by school administrations in providing special education and education supports for students who've been impacted by opioids. We identified some evidence-based or evidence-informed strategies that might help address those. We prioritize those strategies with the understanding of what the priorities are that are outlined specifically in the MOU and the approved uses. And also just thinking about what the amount of money that's available versus really the challenges that many school administrative units face. And then we had a discussion about how do you prioritize quote unquote most impacted school administrative units. And we have some other considerations for the RFP process. So I think what was interesting in the conversations, and Melissa, feel free to jump in, and I think I said this when I've talked about this before, the group was highly, there was a lot of consensus. And there was a huge consensus that this is by far the biggest challenge that schools are facing, and that there is a higher intensity of challenging behaviors in classrooms, a higher number of students with behavioral health challenges, with many students who've been, many of those being students impacted by opioid use or some sort of substance use disorder. And that educators and administrators don't always have the resources, tools, and skills to address those higher challenges. And this may be leading to more families feeling that their children are being pushed out of school. We talked about this for a really long time. There's a ton of consensus around this. In your document, there's in the report, there's a link to a very specific resource that one of our council members or work group members, Sarah Wilkinson, had put together with her colleagues around those higher behavioral health challenges that school administrative units are facing. Totally recommend looking through it. It's really interesting to think about what folks are seeing and their lack of tools and resources for dealing with it. So some possible strategies. I mean, I think part of the issue here, this is when it comes down to like what's feasible. But I think folks really thought targeted inclusive training and TA for schools was a real possible strategy that they would recommend, and interagency partnerships between schools and community partners for supporting young people and their families. Some key notes about this challenge or about the strategies was that there was, again, like super broad agreement that training was not sufficient, and that in order to have an impact on improving skills and increasing the capacity for school administrative units to actually address challenging behavior, it has to be paired with technical assistance models. And in the report, there are some really clear models that have been shown and are evidence-based to support actual skill building and use of those skills. So training is not enough. Another challenge was the identification and misidentification of prenatal substance exposure and how that translates into special education. Some children are being misidentified, and then their interventions are not meeting their needs. Some of the possible strategies that were identified were training for school psychologists and special educators on how to identify, better tools for identification of students impacted by prenatal exposure. This one has some pretty serious limitations, and I'd say what we heard was the biggest limitation is that there doesn't appear to be validated tools for identifying students who have, a traumatic brain injury from exposure to substances prenatally. There is a tool for identifying fetal alcohol spectrum disorders, but that's somewhat different and isn't quite doesn't match really what we're talking about here. So this is while a very big challenge and wanted to keep it as a challenge, there really aren't the tools needed yet. Another challenge is getting the appropriate resources to children is that parents who are struggling with current or past addiction may worry about shame, blame, and losing custody of their children and may not seek help. There are some possible resources, strategies around resources for schools to provide parent training and engagement, equipping schools with more resources and tools for addressing the needs of students who have specifically been impacted by prenatal exposure or, and related brain injury. Some notes here that the Maine Parent Federation currently does provide parent education advocacy training. They also have a statewide family engagement network. DOE is piloting a parent training app with resources and TA. So this could help with screening and of exposure disorders and reducing stigma. So there were some resources available already. And then lastly, this significant workforce shortages in special education. And, some strategies are recruitment and retention of special ed teachers, additional providers that could assist. So that connection to outside community resources. There were concerns around ongoing funding. If schools use this to recruit or to help bring folks in, those eventually have to go into school budgets. So there were some thoughts about that this funding might not be the perfect fit for trying to address this particular challenge. So the final recommendations for the priority strategies were really around that first challenge. So targeted intensive training and TA for school staff focused on working with students impacted by opioid use disorder or substance use disorder, and really especially targeting that ages of 3 to 8. And that was chosen because that's in the MOU that we have, that there really are would have an emphasis on targeted intervention or targeted work that would reach the 3 to 8-year-old population. And the strategy that the group really wanted, this in bold letters, must include technical assistance for implementation. And there are models for implementing TA that could be train the trainer, community practice, coaching and performance feedback, or some other evidence-based adult learning model for ensuring that the skills are actually utilized to support students most impacted by opioid use disorder. And then strategy 2, interagency partnerships between school and community organization. Many schools are being tasked with providing behavioral health supports to students, and yet they aren't receiving the funding for that. They've become kind of the de facto children's behavioral health organizations in many part of the state, but without the funding. So trying to create some partnerships where there can bring in some community partners to support and braid some of those resources, they've thought would be really helpful for school administrative units. So there are some other things here. I'm going to turn this over to Melissa.
Thanks, Liz. So we did really spend a lot of time talking about most impacted, and I would just name some of the challenges of identifying most impacted, right? That could be children, individuals who were specifically exposed prenatally to substances. That also could be children who were in families affected by substance use disorder or communities that were highly impacted. And so we really wrestled with that as a group of how might we focus the funding, wanting to think globally and in a focused way about those different impacts for different children and communities. And there's a lot of limitations to the data in terms of what we can understand about those differing impacts and the specificity of those impacts, particularly within SAUs, which are not typically how we look at data. We look at a county level or a state level, and looking at that data within an SAU is a little more challenging. I do have the benefit of my organization does a lot of data collection around kids and families, and had some data that was available to share with the group, both around rates of special education, looking at trend lines around special education services and identification, and then by disability type. And so we provided this data to the group to sort of say, because we are thinking about what would we ask SAUs to identify the data that they're bringing forward to sort of make the case for how their SAU is most impacted, and wanting to look at some of the available data with them to talk about how helpful or limited would these data sets be in SAUs making the case. There are some trends that I think are worth considering. There do tend to be higher rates of neonatal abstinence syndrome or NAS in rural areas of the state. Some counties have much higher rates of children who are identified with disabilities. You can see that on the slide here and also in your printout. And the biggest diagnosis for special education is broad as learning disability. So in terms of our understanding of what's happened, how children have been impacted, how communities are impacted, we do have some references, and also recognizing the limitations of those data sets. Thanks. So again, thinking about, we wanted to offer back to the MRC as we're thinking about an RFP, how we would guide SAUs to consider demonstrating what most impacted needs. Some of those data sets might include substance exposed infants data by county and trend line, Maine Integrated Youth Health Survey by county and by questions that are specific to this issue, the special education data that we just looked at, and overdose or substance use disorder data through the Maine drug data by county. So thinking about both at the individual level impact, at the community level, at the family level, trying to look at some data sets. Again, a lot of limitations, and we talked about the limitations, and we do have to use something to guide the decision making. I will say, just as a reflection, I think the group was really just a lot of gratitude for how quickly they coalesced around the recommendations, thinking about feasibility and thinking about impact. I think we had a more challenging time talking about the RFP process. I think their expertise was really in what our community is dealing with, what our SAU is dealing with, but we did really urge them to think about taking the opportunity to offer some guidance to the MRC in the RFP process. It won't surprise you based on what Liz just presented that they talked a lot about technical assistance and asking the MRC to think about that. They really emphasize that training, especially as a one-off training, is not going to be impactful or helpful, especially as they look at the amount of funding that's available. So really thinking about what technical assistance looks like to SAUs in implementation and replication, and that being a really important component of how support should be outlined through the RFP process. And in particular, again, thinking about the scale and scope of the impact on the school community, how they might be analyzing and using the data for in their proposal, and what evidence-based trainings and technical support they would be identifying. We did talk to them about the grant funding timeframe, and I think as much as we did in the prevention work group recommendations, there was strong support for giving a long timeline for this, 3 to 5 years. And they reflected on the fact that even if fewer SAUs got funding, there would be an opportunity for them to sort of cross-pollinate with other SAUs as they were implementing to be able to share the learning. For the funding amounts, they really suggested that we ask the schools to make a compelling case for whatever funding amount they thought was appropriate to meet the needs. And there was some conversation about focusing on depth instead of breadth, that they really didn't want us to stretch the money out too thinly, that it was more important to make sure it was implemented effectively, and then we could consider how to replicate in other communities. We got really specific about the RFP timing, which was helpful, right? School administrative units operate on their own timelines in terms of when they're in school, when they're seeking grant funding. And so they really suggested that in terms of ideal timeframes, that we open an RFP between November or April or in the summertime, those being times that they identified as having more capacity to consider an RFP and write a proposal, and then also giving them a longer window of time to be able to do that. They also specifically recommended that we avoid, I think these timeframes will not be surprising to folks that have worked with schools before, avoiding an RFP in September, October, May, and June, the beginning and the start of the school year, not being helpful times to roll that out. And then I think they just emphasized that it wasn't as important in terms of when the money gets out the door to them. But we did also talk about, Brendan was really helpful on this because he looked at national funding around this and the RFP at the MOU for Maine, as he always does, and kept reminding us it's not schools, it's SAUs, but also thinking about what the communication looks like, really wanting to make sure that lots of SAUs are available at the opportunity. And so we did talk about the opportunity to ask the Department of Education to send out the RFP when it becomes available as a priority listing for special education directors and superintendents. MADSEC, who had representation on this, also said that they have a listserv that they could put out to their special education directors.
And I'll just say one other thing that I forgot to put on here, but there were some school administrative units who did receive some funding from the national settlement. They applied for it and received it. There's a list. We could probably find that. So that might also be a consideration for the RFP process if we wanted to spread out the funds. That we may decide as a group that we wanted to limit it to those who hadn't received that money, or that you want to double down. I don't know. I just want to say that there are those. I can't remember exact number. I want to say it's like 11 maybe school, or maybe it was 6. Ooh, I don't remember.
I have 6 in my head, Liz, but I don't have it in front of me either, so don't quote us on that. But there are some school administrative units that applied for the national settlement funding and received that. And Brendan did share those materials, both who received the funding as well as the RFP and the process through the national, and strongly encourage us to consider that in terms of the RFP process here in Maine.
Questions?
So I wonder if you all have questions.
Colin?
This is great work. Thank you very much, because, you know, this has kind of been over us since the start, and we didn't know where we were gonna go with this, and this is so helpful. Can you give me a, just an example of what technical assistance might look like? Did anyone in any of these meetings give any,
Yeah.
I don't know what I don't really know.
Yeah. So there are lots of ways to do technical assistance. I think what it means in this case, there's some examples here where you may have a training you want to give to all staff in an elementary school, and you go in and you do a day-long training where people are learning how to use techniques, to deal with challenging behaviors, or they're learning about pathways for referrals for young people who are having issues in the school. Well, that one-off training, now you go to do the work, and it's hard to implement some of those things you learned. So technical assistance is essentially a way of now taking that learning and helping people actually build the skills or ways of then implementing it. So it may be that you have a community of practice, so everybody gets trained in something, and now an advisory team. So say there's the first grade team, they meet every week for 2 hours, and maybe in that community of practice, they spend an hour of that time talking about the skills they learned in the training and how they're using it in their classroom. And they're talking through difficulties of making that happen. And so it's a model for actually utilizing the skills. I'm sure you're familiar with that probably happens in physicians' offices too, or in a healthcare setting, where it's how do you might have a coach who you talk to about how it was hard to implement something, or what are some challenges that you faced, and then you get professional guidance on how to make those shifts and changes. So it could be community practice, could be coaching and feedback, could be that you train a bunch of trainers in the school, and then those trainers go do training and TA, so that it is wider than just a one-time training.
Thank you, that's helpful.
I think those are really great tangible examples, Liz, and examples that people lifted up, in particular, just the emphasis being providing ongoing support as people are implementing the learning rather than a one-off training. So lots of different ways of doing that, and I think we would want to think about how we're asking schools to identify not just technical assistance, but what exactly do you mean by technical assistance, but the emphasis being one-time learning is insufficient. It needs to be more ongoing and supported.
Okay, thank you.
Yes, you had a question?
I did. First off, this is incredible. I appreciate you all taking the time. This is really clear. I like the way that it's laid out, including providing some limitations on each of the recommendations. It's been a while since I've read some of the details in the SAU MOU. And Liz, one of the things that you had mentioned around strategy number 1 was targeting ages 3 to 8. I was wondering if it's allowable in the MOU 1, or if it came up at all, if any of the folks in this group talked about how we can support young people who have substance use disorder. So when we think about, the age of first use, 12 or 13, that's a really common number that comes up, and that can be a predictor of the severity of the substance use disorder for that individual. So I was just wondering if that came up at all as a topic, or something that these funds could help support.
Again, I don't have the MOU in front of me, but my recollection is it clearly says a focus on this, because I think what you're speaking to, Tess, makes me think about the prevention funds, right? As early use, what does that indicate? What is the support for that? The school funding is really focused on special education needs as a result of being impacted by substance use disorder, either trauma from being exposed to that in a family unit or in the community, or directly because of prenatal substance use. So that's why it's targeted to 3 to 8, is because it's around special education, increased special education needs as a result of that exposure. Liz,
Yeah, I can actually read the bullet if you want me to. There's a bullet on the second page of the MOU that says applications that target services to children under the age of 8 where the potential gains are the highest is what the Recovery Council will give priority to. So we do have some like specific, and so I think it is this tiered approach test that you're talking about. It's like, this money is for that early childhood, like supporting special ed. I think we need to continue to do and fund sports for primary prevention, that really is targeting how do we limit the amount of young people that start using early, and also how to support them once they already have been using, which I think are different funds, I guess I'll say, than these funds.
That's super helpful, and I think hopefully for the general public that clarification, because I think when you hear school, that can mean such a broad range.
Yeah, it's a good flag.
Correct.
Yeah. Betsy, you had your hand up?
I do. I found the place. Liz, couple of questions. First of all, how many SAUs are there in the state? Ballpark is fine. I didn't mean this to be.
I think it's like 120.
Okay, fine. My
Or
second
am I way off, Melissa?
No, I think I had my head in 100 plus, but I have to look at it.
Yeah.
Someone
Okay.
can Google it right now.
Yeah.
That's not my real question. Is this: some of the SAUs are 2 communities, some of them are 11. Is there going to be a way to take that into consideration when you start looking at how you're going to perhaps structure an RFP?
I would think the answer would be yes. We would want to take that into consideration, especially when it comes to this issue of funding, where the work group members were really saying that the RFP should ask the school administrative unit what to create a compelling rationale for their funding amount, right? So
Okay.
a large SAU might say, really, for us to do this, we've got, 7 schools and they're really spread apart, and so we need more funding for that. Or, hey, we only got 2, but we have super impacted, but we think with this amount of money, we could really make a big difference.
Okay, or half our population qualifies for free and reduced lunch.
Totally, exactly.
Gotcha. Okay, thank you.
Yeah, I would come back around to that, just a plus one, what Liz shared, that the group really emphasized putting it back to the SAUs to make the case, right? So make the rationale for why they think it's this figure versus that figure. And I think the size of the community, how they're conceptualizing impact and demonstrating that is all going to come into that funding amount that they come up with. I also would just add, because I think we've experienced this in all of the pillars, the work group members like very quickly said like, oh, it's only this much money. And so I think I just want to offer that they all share to like, if you want to do more than 3%, like we could definitely help you think about how to utilize that. But I really appreciated that there was a kind of, oh, it's only this much. And then they very quickly said, how do we really make the recommendation around what's feasible with this amount of money? So I feel like I would be remiss in not representing that perspective from the group.
Thank you. I would also say rural versus urban.
Yeah.
Not just, there's lots of rural school districts that don't, I feel like sometimes we don't get to compete in big arenas because we're small. Or there's a perception, well, you're small and you live on the ocean, so you're all rich. It's not true. There's a lot of, I think, characterizations of communities like mine that are false narratives. In Lincoln County in particular, we were hit really early and really hard. We have a lot of kids in our schools that have parents who are no longer with us, growing up through their school years because their parents are dead. Because of how impacted we were. That misperception that everything's great in Lincoln County because people all have money is so false. we struggle to get to 51%, but oftentimes that's the refusal to fill out the form. Because when you live in a community where you have tremendous disparities between abject poverty and extreme wealth, this side gets pushed out even further. It's isolation. Or I just am making a pitch for small rural communities, because that's why I'm sitting here.
That could certainly be a consideration for the RFP, and I will say, again, it's because I don't have it in front of me, I think that was lifted up in the national settlement, was looking at school funding and how that impacts schools' ability to respond to these needs. So rural, urban, I think fits into that as well.
Right, for instance, we're a minimal receiver, we don't get school funding. Well, we're not a minimal receiver because everybody there lives in a great big house with $1 million mansion. It's because we have so many hotels. And they're valued at millions and millions of dollars and throw us right off the map. So I think school funding formula is a whole different day.
Yeah.
We
We don't have time about it.
We are not gonna go to school funding.
But it's in the mix, for
I
sure.
think that rural isolation and paying attention to the nuance is very small.
Yep.
Consideration. I have just a couple comments. One is, again, this is fantastic. Glad that we spent the time, got people in there. I do have a concern when I look at strategy 1, it says age 3 to 8. Most public schools don't start until age 4, so I was just interested is why that group is picked. And the other piece is, I love the RFP timing piece, but I would eliminate summertime too. Because again, most schools, and I'll say this nicely, have union contracts. And asking people to work outside the union contract costs the school money. They have to pay people. So I would try, I think if we did it, to work within that time frame of what was here, it was November to April, that would probably work better within schools. But as someone who worked for a school system once, the union contract matters. And so you have to work around that. Or cost school money to do it. So it's just a comment, but this was very well done. The other piece I'd ask you is, this is great. So what are your recommendations for next step? Should this go to programs and grants to try to finalize and look at as to how to get, what will the RFP look like and how do we get it out? Or are you looking for other recommendations?
I'm trying to remember how we did this with the prevention work group. Did we accept the recommendations and then work out the RFP? That's my recollection. Liz, you're nodding.
Yeah, I guess I would say like what I would love for today is if the group would vote on the recommendations and of the priorities and discuss any differences or something different than you want from the considerations for the RFP process. And then I don't know where we're at with RFPs, like are committees writing them? Do we now have something in place for PCG to help with that? Like, I think this is ready now. If once the council says they're ready to vote on this, it could go to somebody to work it up into an RFP.
And I saw Maggie had a question or thought.
I'm happy to wait till it close this one out. PCG or whether it goes to PCG.
So here's the comment that we have to consider, and it's a budget comment, and I hate to say it, but if we contract that out for somebody else to do, it costs money. Will that money come out of the school funding process, or will that come out of what I would say the general Maine Recovery Council funds? Or are you gonna take it directly from the school account to be able to do that?
I'm not sure you can take it from the school account. I know Brenda's not here, but it has to specifically be used, the 3% for the school administrative units, which doing the RFP would not, I don't think would fall under that, but I mean, he's the lawyer, so we should ask him, but I don't think it could.
Yeah, I'm with you, Liz. I don't think it did. I just needed to bring the question forward.
Yeah.
Is PCG in a place where this is something that they can start to take on?
No, yeah, I mean, they're still building the database for the grant management side. So. Do we even have built in for them to write the RFP or just the other side of the thing?
I would say if we need to split this out, I think voting on the priorities today would be great. Unless anyone's opposed to doing that, voting on the priorities at a high level And then we can take it to program and grants to sort out the RFP process.
I love it. So do I hear a motion that we accept the priority list or the report from the school funding project?
So moved.
It's been moved by Paul and seconded by Holly.
Okay.
I do that.
Oh, you just did silent.
She did this. Discussion.
Liz, does that get you where you need to go, you think?
What? I can't, it was hard for me to hear you. I thought we
We're
were,
just voting on the motion that accepts the report as written.
Great.
And the
Right, the
recommendations.
prioritization, my understanding is we're saying we do wanna prioritize the priorities that were recommended.
Correct.
exactly.
What I don't wanna do is kick the can. And I don't mean that, that's my words, I don't mean that in a bad way, right? I think a lot of work's gone in here, I look at this much like we approached the prevention piece, I think we have a great recommendation here. And I don't see, I just wanna slow down the process. I've only got a couple of more months before my term is done. It would be great to look back and say we got some more things done. And if the timing is right, so if we get this going, it might coincide with the opening of schools this November, which would be really cool. So I don't know, that's just me not fully understanding the timeline. And you know, it seems to me that the decision is not necessarily, I think it's pretty clear to me, maybe I'm wrong, that we don't have enough staff of our own to do the RFP and manage it. So we're gonna need to go out and either use an existing vendor or, and I'm not sure what role programs and grants has there, except for to say, yep, we need to put this out to RFP. Maybe develop the RFP or whatever, but, so I'm sorry, I don't mean to be, I'm just trying to get my head around just not prolonging the process.
Liz?
Yeah, I appreciate that, Todd, and I also think we do have the 2Gen RFP that we haven't even touched yet, and you know, I feel like, you know, Melissa and I know some things about that, but like I don't have time to write the RFP or come up with one right now, and so and now we've hired out HRA to do the other part. Like, could we ask them if they could do these two RFPs? Like, I would be down with that because they have a template for doing it for the other prevention one, and they're utilizing their. Yeah, I have no idea if they would. I'm just saying I'd be down with asking them to do it. They've created a really beautiful RFP for the community coalition work.
Just remember that the motion is just accepting the report, not
Yeah.
the process of what happens
Great.
next.
Great.
This motion is just about accepting the report.
We can separate these two things then, perhaps.
Let's
That's
separate
what I
those,
was trying to do,
because
separate those,
first we
yeah.
have to know, are we accepting this report? Then those timeframes, those steps come next.
And just
Okay.
it being that
It's okay.
we're
I was trying to-
prioritizing
yes.
funding strategy
Yes.
1 and 2.
Yes. So if there's no other questions about strategies 1 and 2 and the vote that we're about to do, not voting anything else, just voting to accept this report. Do we hear any discussion? If not, could you call a roll, please, Travis?
I just wanna clarify again, it was Paul Holly.
Yes.
Okay. Betsy,
Yes.
Okay.
yes. Holly,
Yes.
Jamar,
Yes.
Liz,
Yes.
Maggie,
Yes.
Melissa,
Yes.
Pat,
Yes.
Paul.
Yes.
Tess,
Yes.
Todd.
Yes.
Right, motion carries, thank you very much, a lot of good work. So at this point,
Can I
There you
make a
go.
suggestion?
please.
It's 3:00, we still have a lot
Yes.
to get through. Can we have this debate about process and program and grants?
Yes.
And so we just move it, I know it won't be, it'll still make some time, but I don't think we're gonna get through it with the other items on our agenda and still close out and make progress on the other agenda items.
I think that if you take it, it's just my opinion, if you take it to program grants, I think we can say we're gonna take that time at that meeting to put that through. Right now, you're gonna rush through things, and I think that if you take it to program grants, can't currently think even what's on the agenda for next month. Again, I don't think it's much. Anyways, they can really make a recommendation and also give Chastity, if there's questions about who's available to do that kind of work for us, you're able to do that. Today, we don't really have the time to give it the thought that it needs to have, but that's just me. I don't know how anybody else feels.
I agree.
I'm not following you. So I don't have any problem, I was prepared to make a motion. But I won't.
What was
If
your
I were to
motion?
make a motion, it would.
But just say it hypothetically, what would that motion have been?
You know, I was thinking that, I think we're saying the same thing, that I'm fine with the recommendations. I'm prepared as a council member to approve these recommendations, not just accept the report. But say we wanna move forward with these recommendations.
That's what
That's
the
what we just
motion
did.
was.
That's what the
That's not what I just heard. But, so what I just heard is that, okay, we accept this report, it's very nice, it's well done, and we accept it. That's what I heard.
No,
No,
I specifically wanted a motion that we approve these recommendations
Not just the
and
report.
we work towards those recommendations, not just approve the report.
So what we're asking programs and grants to do is to help us with the RFP, come back with a recommendation.
Correct.
Yeah.
For just the RFP.
Okay.
Okay,
A recommendation of how the
I'm with
RFP
you,
will
I'm
look
sorry,
and a time frame for that.
Yeah. thank you.
Okay, let me clarify that, okay. So if there's no objection, that's what we'll do. We'll see Joe didn't show up for the meeting. This is what happens, Joe, you have more work to do. So we will I will make sure we contact Joe and tell him that is, and that's really sort of monitors what we did with prevention, and that was very successful. So, thank you. Liz and Melissa both, thank you for that work. And as someone who's worked for a school system before, I'm sure the people who do are very grateful that you listened. They often feel like they're miraged with a lot of problems and they're to solve them without given the tools to solve them or even an ability for someone to hear them.
Yeah.
So, I appreciate that.
Pat, if I may, before we move on, I just want to say again in the public meeting, the gratitude to the folks that Liz listed at the beginning. They really contributed a lot of time to coming together, looking at things, reviewing, providing feedback, and did review the recommendations before we brought them to you all. So really lucky to have their expertise at the table.
Thank you very much, good work.
Can I also just add, in the larger council folder, there's a school work group folder, there's a larger, background document that all of the work group members, added plenty of resources to. So in that folder, there's a list of all the litigating school, subdivisions that everybody asked about, that's in there. So I can, at the end of this meeting, I can share that link, but all of them work very hard on this, and there's plenty of resources also in that folder that you all have access to, so I can share that too. So you guys don't have to go digging for it, but there's plenty of stuff in there as well. Easy access to that.
Thank you, Elizabeth. All right, so we're gonna move on to FOA requests. You all are aware that we've received. Liz?
Oh, I guess that was a wave.
Oh, was that a wave? Bye, Liz.
Yeah.
So you're aware that we had some FOA requests, so I just wanna share a few things in here. One is, Brendan is not here today, so if you have a legal question in regards to the FOA, I would appreciate it that you either speak to Brendan about your legal questions in regards to that, or filter them through Elizabeth. I also wanna remind you that Chastity has declared a conflict of interest with this FOA request, so she is not taking part in gathering that information, but the lead for the gathering the information and getting it to where it needs to go is with Elizabeth. And so Elizabeth has that task, but again, we have to respect conflict of interest because it's important to us as a group. So I'm gonna give Elizabeth a little bit of time to share with you where she is and what she's doing with that. And then we'll go on to the rest of our meeting. Elizabeth.
Great, I don't think we need to go to Brenda, I just wanted to give you all, make you all aware of these, and that I am working with Brendan, to respond to these, and I think that's really all we need to say on that. And then the other thing, and I don't wanna make this into too much of a thing, is we are all aware of the conversations, public conversations around, public meetings, not just our meetings, other meetings,
And so we're monitoring that, and if that interferes with our meeting at all, we will make you all aware. For right now, that means please just make sure you sign in, at the sign-in sheet. We're moved around, I don't know if on Zoom you can tell, we're flipped today just because the camera or the computer over there is not working, but, so you may in the future be asked to sign in on the other side, not that big of a deal, but, we're just from the front, at reception, we've been asked to just really make sure everybody is signing in and signing out. But that's the only change for now. But again, if anything else changes, we will let you all know. But again, we are aware of, there is a lot of scrutiny on public meetings, and we are monitoring this. But yeah, if anything else changes, we will let you know. Thank you.
You said we are all aware. I'm not aware. I don't know what you're talking about.
There's a lot of stuff going on social media of people showing up to meetings, and being, not contributing, in a productive way to the purpose of meetings. And so we're aware.
People on the committee?
No, general members of the public, and so we're aware that that may happen at one of these meetings. And so we're aware, and the building has asked, there's a police officer outside just in case things escalate and things like that. So just so everybody is aware, we don't want to make this into a bigger thing, but we are aware, so. Just so everybody knows. Again, if anything changes, we will let you know.
And again, we are complying with the law, and providing the information to people in as best timely manner as we have. As I said, we only can have one staff member working on it, so we're doing the best that we can. There was a lot of information requested, and we will honor that.
My only question is does Elizabeth, Chelsea, whomever, you guys have the resources, do you have enough, you're okay with help doing it? Anything we can do to support what you're doing?
I don't think so, no.
Cool.
Thank you.
No, she's good at reaching out if she can find something, so it's a good thing. Reaches out to me, reached out to Betsy in regards to some minutes, so she's been doing well with that. So, all right.
Just a lot of time.
Just a lot of time. I always try to look at everything in a positive way, just organize us better.
I'm not kidding.
All right, so there's no other questions about FOA. We're gonna move on to a quick announcement. Make sure people are aware that the Governor's Opiate Summit is July 16th in Bangor. Makes me happy, I don't know about anybody else, I'm in Bangor. There also is a pre-conference section people can sign up for. Also, it's the evening before, sponsored by the Bangor Public Health.
And people can sign up for that the night before?
No, they're asked to sign up in advance.
Right, but I would be able to go to that if I wanted to?
Yeah,
The dinner?
they should have sent you a link.
I don't believe I got one. When I signed up for the opioid summit,
Yeah,
but
and the
I did
night
not get a
before.
link for the night before.
I can share them both with you. I'll share
That'd be great.
Yes, I'll make sure everybody has everything.
Gordon Smith, from the Governor's Office. Just to be clear, people can come to the Wednesday night event, there's no charge, there's no fee. There's a registration fee for the conference itself, but you can also apply for scholarship, state employees are exempt, probably you're all exempt for, because the council's presenting a breakout.
Well, we're not presenting.
Oh, you're
Not this year.
You're not doing a session.
Well, I'm doing one in conjunction with somebody else.
Well, I'm
Council
kind
itself.
of, yes, I'm kind of, but any of you that want to register, you're welcome to do that. And just check you can check as a presenter, or you can check as you'd like a scholarship, and that will automatically waive the fee. I think the contribution you make to sitting on this committee is enough to earn your keep. We do that for the clinical advisory committee. We do it for lots of people. And we're very excited about it, but I think it's what the public understand. There's no fee associated with the evening program, but we do ask people to pre-register. We've already got 100 coming that night. We'll probably have 200 for that. We'll have like 1,000 people for the summit. And finally, I really appreciate Elizabeth. We're borrowing Elizabeth's time to help us with the tabling, as she's always done. We've already got 47 tabling organizations. We'll probably have 60. So we really appreciate everything that you all do, and it's going to be a wonderful day, and I hope you'll all make it.
Looking forward to it. All right, thank you, Lord. All right, so the next thing was just a brief discussion about strategic planning about Carol Kelly. As you know, Carol is doing one-on-one conversations with different stakeholders and members of the council, as well as she's trying to meet with A.G. Fry and have some conversation with him. She was hoping to join today, but she's unable to. She'll be joining the July meeting to discuss some of the interim recommendations that she has seen in the strategic plan. And the goal has been a little bit challenging, and at this point, we're anticipating September meeting to present a draft, and the November meeting being the final and approval for the strategic plan. She's hoping to be respectful of the council members, that the 6 of us that are going off, and hoping that that is before the end of our terms, so we keep plugging and moving forward. And those are the 3 things I had on my report. Yes.
When we originally contracted her, and if I remember right, the language we had used was more around like a retreat, and it sounds like now the language is more one-on-one meetings culminating in a report. Can you kind of help clarify some of the changes there?
Yeah, in meeting with Carol and from the conversation she has had with other people, it got brought up, if we do a retreat, how much are people actually gonna talk and like go through things because of the whole public piece? So this way, people will be able to actually meet, talk through like their vision, and then she can put it all together and bring it back to us. And then from there, like it'll still be a public talk, but like the in-depth stuff will be smaller.
Any other questions about Carol Kelly's work? Thank you. All right, committee meetings. I am going to turn it over to Paul with governance.
All right, thank you. We have our governance committee meeting May 22nd. Most of the time was spent on this issue of public comment. There was a federal trial court in Maine decision looking at, I believe this was a school board meeting, and this trial court, the court decision was that their rules for public comment were too vague and violated the First Amendment, free speech. Specifically, they had something in their rules saying prohibiting foul language and saying that language had to be respectful was too vague. So there's a couple, Brendan had some recommendations for just a couple changes of this in the sentences of our rules for public comment. But he also said that the Attorney General's office is going to issue firm guidance within the next 2 months. So after a lot of discussion, we decided to keep the language that we have until the Attorney General's office gives firm recommendations of what to change. But that we understand that our ability to limit language may be limited. We certainly could, if something is racial or is specifically targeting someone, that would be not allowed. But it may, we haven't had this problem at all too much, really. But
Sorry,
we could come up again. Now, the 3-minute limit was felt to be good, felt to be fine. So whatever someone says, they can only say it for 3 minutes. And Pat felt that she would be able to manage that.
I did.
Yeah.
I worked adolescents for years.
Yeah, there you go. So that's
substance rehab.
So that was a good big part of the discussion. I thought it was really interesting. Our orientation will start in August. It'll probably take up half an hour or so of the August meeting, and in September. We're planning to make it, each presentation be relatively short. I will be presenting on the medical aspects of the opioid crisis, and Tess will be talking on the really the social and the personal aspects of it, how it affected people. And Brendan felt that he would be able to use about 15 minutes or something, either August or in September, for his discussions. But we're moving right along that. I've started my talk for the August one. I think I could probably make it fire. Maggie's going to bring some information for the employment process to the next, or the contracting process to the next meeting, which that'll probably be a big thing for our next meeting. And there was a discussion Elizabeth brought up about public behavior during meetings. And I wasn't sure where that was coming from, but this, Elizabeth, that might be what you're talking about, okay? And I really didn't know what she was talking about. So that clears things up a little bit for me. And that's about it. Any questions? So we'll have our next meeting 2 weeks from tomorrow, I believe. And Elizabeth, I'll get you, I'll write the agenda tonight or tomorrow morning and send it to you, okay?
The 26th.
The 26th?
26th of June is your next meeting.
Okay.
All right, thank you, Paul. Finance, Deb.
Yeah, I don't have a lot to offer because we did not have a meeting. We had a very robust finance conversation in the full council, so didn't feel the need to meet. But just in terms of where we are financially, I'd like to at least let you know what our balance is. And our balance is 27 million, just over 27,100,000. So we're still doing pretty well, but that's also just understanding that some of that is already obligated. I don't have my numbers right in front of me. I got the reconciliation sheets from the Attorney General's office a little bit late, but I'll have all of that information for our next meeting. But not a lot has changed. I will just also say that for the month of May, very interestingly, our amount of revenue that came in and our expenses going out was the same, save a couple of dollars, which is kind of unusual to see, but not much else. And thank you all for the meeting, our last meeting where we were able to go through the calendar and the budget. That was really exciting.
Thank you. Questions for finance? And now we're going to move to program and grants. Joe sends apology. He is unable to be here. But the major focus of program and grants is you all should get a draft copy of the design and management, the MRC, micro and off-cycle grant funds are in there. And we're looking to, I'm hoping you had the time to read it and ask some questions, but I'm going to turn it over at this point. Maggie, to give any highlights to it, and also to field questions.
I realized a typo on the very first line. It's not off-cycle grants, it's urgent grants. So I apologize on that. Okay, so most of you are pretty familiar with this document already, but I'll go through what it is first and then some changes since we last spoke at program and grants, and then we can check. So this really is like kind of the accumulation of many different inputs. Ultimately, the goals we're trying to solve here are finding a way to get money out the door faster in response to urgent needs. And that's one goal. The second goal is finding a way to just get money out the door in response to small grants. Yeah, sure. Yeah, we put it on the screen. And so we ultimately decided we can't do that within our own structures. It's too cumbersome administratively for us to be able to get things out the door and to meet those needs. And so we need to have a vendor do that work for us. And so this outlines what our intentions are. And then our hope is vendors would apply to take on this work for us. And then we could contract them to do it. So Broadly, it includes some background that explains how our normal funding works, and then basically says this is meant to be a separate and complementary source of funding and not duplicative. It needs to be in line with the MOU purposes. The opportunity section really just says we're looking for a vendor who would lead in the distribution of the funding for these small and urgent grants. They would be the one who establishes the kind of the call for proposals. They would be the one who judges the call for proposals, and they would be the one who issue the funding and follow up monitoring. And then it breaks down the fund uses under those two sections. It is clear that if somebody had brought, or if an institution, and this is only available to institutions, not individuals, but if an institution had brought a request to the MRC during the normal grant cycle and was denied, they can't use this as basically a secondary pathway by which to access money. So it has to be for a different ask than what was asked through the normal process. Under small grants, and maybe before we get into details, I'll pause to say, we did have a lot of back and forth about some of the finer points within these details, and ultimately none of it's perfect. And what we essentially said is we really have no idea how this is gonna go. Hopefully we even get a vendor. We don't even know if we'll get a vendor. But this might be all out the door in 3 weeks and that's that. Or it might be at the end of the year there's a balance left. And so a lot of the things that we talked about and ranges that we set, they're kind of our best guess estimate, with the assumption that we'll learn a lot with the vendor in that first year of what worked and what didn't. And intentionally, in line with that, we embedded language in the very end of the document around renewal, saying, following the initial term of the contract, we may opt to renew for 2 additional periods. So in principle, this could be a 3-year contract if it's renewed for those 2 periods. With the vendor, but that also gives us the flexibility after year 1 to say that, oh wow, those ranges weren't the right ranges, or we need to add more structure, etc. All right, so then getting a bit into the weeds. Small grants, that's supposed to be meeting the needs of 5,000 to 10,000. The total funding pool cap we put on that was $200K. But we said that's our best guess. If the vendor has a strong reason they feel a different range is appropriate, they can put that in their application. We'll certainly consider it. To be eligible for this type of grant, the institution must be able to demonstrate it would have impact. We don't want these to go out for regular operational expenses. These are meant to be really one-off funds, so it can't pay the lease for a month if there's no anticipated change in the ability to pay the lease the next month. And we included some examples to show that. We emphasized in this grant management section that we really want the administrative burden to be tailored to the level of risk. So a smaller grant is going to have lower risk associated with it. We expect it to have slightly less kind of administrative burden associated with it. That being said, for any vendor, getting a grant out the door, whether it's $5 or $500,000 can sometimes be the same amount of work. Then we have this other category, urgent grants, and this is intentionally not off-cycle because in principle, urgent grants can be any time during the year. We're no longer working on what we do versus them. What we do is going to be different than emergency grants. So urgent grants, and we use urgent instead of emergency because we still won't be able to turn money around in 24 hours for a vendor or otherwise. But these grants would be up to a higher value of 50,000, and the total bucket allocatable to this purpose is 600,000. These numbers, 200K bucket and 600K bucket, were based off of the rough budget we have for the year, operational budget. Again, we want to see an urgent need, so it has to be an urgent need associated with harm reduction, treatment, or recovery that cannot be deferred. We need to have documentation to prove that. It must result in a service benefit or prevent significant loss of service. It must demonstrate the possibility that the services could continue following grant expiration, or in other ways show that this is meant to be one-off. Some examples that were included there include bridge funding between one grant ending and an anticipated grant coming in. capital funding for real estate that's time sensitive or something like that. And again, a note around vendor management needing to tailor a level of support. Before we get into deliverables and weighting and all that, any questions on the substance of what we're trying to achieve or anything there? If you look in your packet, there's this other page that says post-program and grant meeting notes. So there are just some notes on things that we modified in the last meeting and this in there. So sustainability language, updated timelines, things like that. So if you want to see, check whether we remembered the items we talked about, look there. All right, so we have some proposed deliverables. All the vendor applicants are going to have to give us their timeline, and maybe they're going to have different timelines, but this is kind of where we're hoping to land. So basically spend the first 8 weeks figuring out what we need, making a plan for doing it, launch the funds, and then basically it's ongoing until the caps are reached for the year. We would get quarterly reports, and they would do the regular grant monitoring. And their grant monitoring specifics would be outlined by them in their application. There's some slight adjustments here on the weighting for how we would score vendors who come in, and we're hoping it's a competitive process and we have some options. So first and foremost, this foundationally is a grant making service. So we want to score highly of institutions that have a lot of experience getting grants out the door. The next highest weight is for the vision and the plan for how they're going to do it. And then equally weighted is their financial capacity, have they handled this amount of money before, that kind of thing, and then their budget value for service. There's some finer notes. They have to give us their plan, their work plan, their budget, their org chart, their capacity statement, their financial statement, and we have to make sure they're legal. They're responsible. They have to know that they could be forward. And they will send their applications to info at Recovery Council. So there are some details that we still need to kind of agree on. Is everybody comfortable with the first come, first serve proposed here? It was hard to figure out an alternative. If it's urgent, you don't want to wait to see what first come, first serve by nods.
Yes. What do you mean by that?
So you have a bucket of money, 600,000. It's going to be available on a first come first serve basis. So we're not going to do it in cycles.
Oh, okay, yeah.
This quarter, everybody submit. It's just rolling.
So it would be.
That doesn't mean everyone who asks for it gets it.
It should be everyone who asks for it and is justified and eligible would get it until the money's out.
Okay, good.
Right. It would be first come first served, money's gone.
Right. Yeah.
The money's gone, it's gone for the year.
But it wouldn't have windows of time that it was opening and closing. It's open until it expense.
These timelines are, we just noted we could adjust them. They are pretty adjustable anyway. The vendors are going to give us their timeline. We'll have to adjust. I don't think we need to spend too much on that. So then if we can talk a little bit on the dissemination strategy and how we would score the vendors. So we're not held to the same procurement policy as the state, so we could choose. I think we want to hold to the spirit of it, making sure we're getting good value for our services, making sure we're being transparent about why we selected whoever we end up selecting. But we could choose to do a quotes process or an RFP process. Both have their merits. The quotes would potentially be a lot faster in getting us out the door. We also have, it's not a huge cohort of institutions in Maine that have a lot of experience in this area, and so we pretty much know the major players, so we could just ask them if any of them are interested through that quote process. And then the RFP process, obviously maybe some outliers that we're not aware of would learn and hear about it and come through. So thoughts on which approach?
I do have a question, and I probably should know if it's here.
Yeah.
Are we only looking at in-state vendors?
Yes. I didn't say that in this.
I think we did.
We said
See, that's what I did, but I couldn't find it.
They have to give the money to in-state. The grant money has to go out to in-state services and organizations. So we didn't say the grant maker has to be in-state.
Legal status as a Maine-based organization.
Yeah. Sorry.
Oh, it is there.
It's under legal
Number
status.
7.
Okay.
Oh, Maine-based.
I was like, I feel like I just read it.
Sorry. That's what I'm
Take
gonna say, thank you.
Yeah.
You don't have to have that discussion, okay, great. Questions?
Oh, what does that, I'm sorry, what does that mean? Does that mean if my home office is in Boston and I have a license to provide those services in Maine?
Technically, I think you'd be okay.
You'd be
It's just if
Maine-based.
you're only registered in California, then you can't do this.
Like you don't have a physical presence in Maine, but you want
I get
everything
that.
else.
Yeah, you have the legal. Question about the quotes, because I think I understand how the RFP process would work. How would this be disseminated? Would it just, and maybe that's a discussion, like if it's a quote, are we just emailing identified organizations and saying
Yeah.
there's an opportunity, you wanna provide a quote?
I think we could do it similar to like what we did when we got Carol.
Yeah.
I think we'll get more options to reach out to on this, but everyone can give input on organizations that they would recommend, and then just be targeted, we'd send it out to whichever one.
We would send them a letter.
Interested.
Yeah.
And can we be transparent about that too and say like we reached out to these
Yeah,
organizations?
yes.
That's the way we should go, I think.
That's the way I would.
I second
It's
that.
faster.
Yeah,
Alright, seems like we're comfortable
so
with it.
the big question is.
Yeah.
Are you willing today, please say yes, are you willing today, not that to put forward that we accept this draft as proposed by the Program and Grants Committee to move forward?
So moved.
It's been moved
Oh
and
my
has.
gosh, Tess and Todd, can you just have a moment here? I'm like,
You too.
Moving on to the second part.
Okay, as the second, we can have discussion,
I just wanna ask a question, because we talked about it a lot at program grants, I know this is where we came down. I think back to the situation we had with the folks in Sangerville. Right, and that's probably a one and done, right? So, I don't wanna reopen the can of worms, but I just wanna, the dollar amount on the urgent side, right, makes sense on the limits we put on small grants. I just wonder about, I didn't see the language there that made it flexible. We talked, I'm okay with where it's at, I'm not trying to, I just bring it before the council because I wonder, if somebody comes in and needs $100,000 to buy this, whatever, whatever, one of the qualifying reasons, and it's not, I'm not sure that meets what our original goal was to provide urgent funding. Right, so I'm not talking about the total amount, you know what I mean, I'm not asking to go higher, but I don't know if anybody else has any reservation about that. How we would come up, if it's even possible, to come up with any flexibility in that.
I'm gonna take Melissa's question, because it seems like she's had an answer to that, so I'm gonna take Melissa's question.
Yeah, well, I don't have angst about it, but I wanted to offer why I don't have angst about it, Todd.
Yeah.
I think because I wanna try to reflect on the conversation we had at program grants and that I remember speaking to. I think part of this, the funding limits for each of the awards was about how much the council is yielding that decision making to an outside entity. And so I had some discomfort about these higher level funding amounts being decided by somebody else. And I think nothing prevents somebody from coming to the council with a funding request that's higher than that.
Correct.
I mean, I know we're trying to create a structure, but I think that was the tension point that we're trying to navigate. It's like how much authority and decision making are we yielding to an outside organization to make these decisions about funding versus dealing with it internally.
I mean, there is nothing that says, but we do have our blackout period, so we do have those we have to worry about, but there isn't anything that says, if we know an organization, and I'll use what happened with some of the low barrier shelters a couple of years ago, where they were really inundated and needed funding, and they came to us and asked. We certainly can say yes, we can say no. Certainly when the RFPs for the peer recovery centers didn't cover 6 of the centers, we came and said, no, we don't want them to close, we're coming forward. So it doesn't stop that from happening. What this does, in my mind, what it does is it now gives the opportunity for people to come and say, we need this money to do such and such, or we're gonna close our doors. That money is still there, it's under 50,000, but it's still there. But there's also provisions in here that we're saying very clearly that we wanna know about the sustainability of your organization. It doesn't say that, I forget what words we use, but it talks about, you know, if you're asking for this money, what happens when this money is gone? Do you have some sort of plan that makes you forward, or is this truly an emergency? The furnace blew up and we gotta fix this furnace in the center, or we're not gonna be able to move forward. This money will be available for that, but we're also looking to make sure that who we're giving the money to is someone that is sustainable within the next couple of years. I mean, nothing in this field is ever for real. I'm not sure if that answers your question, Todd, or not.
I think it does. I think as long as there's I think what I hear you say is that there's a mechanism. So if something falls outside of this, that's an emergency. It's not part of our regular grant process. It's not, it doesn't fit into small grants, it doesn't fit into a regular stream, it doesn't fit into the prevention money or the education money we just talked about. They have a mechanism to come to the council when we can, as a council or whoever the council is, can decide how to proceed with that. Cool, that's fine. All that mechanisms available. I know that mechanism was there before, that's how we did Sangerville, I keep going back to that, or is it Sangerville, wherever it was there, you know what I mean?
Oh, it's Sangerville?
Yeah, the church we bought, the church.
Yeah, we do own a church.
The church. I'm sorry, not me. We didn't have this available at the time, right, so I just didn't want future council to be bound by saying, no, what you need is beyond the urgent need, so we can't help you until our next regular funding cycle, which is, because someone help in an emergency. That's good, I'm thinking.
Yes.
Yeah, I just wanna say I appreciate all the work that's gone into this, and I feel like we've really come together over a long period of time. And I was just thinking too, like, we're really putting forth a pilot where we're gonna get information to hopefully improve it. And I'm hoping that whoever the vendor ends up being, that they're going to be collecting data on the types of requests that come in, the amounts, the geographic area, and that can help inform the next round. Because like Maggie said, this isn't perfect. If we could spend years aiming for perfect, while there's needs that can be met. So like for me, I'm really hoping that this 1 year pilot is gonna give us a lot of information to improve it and hopefully make it better.
And you can put that in the contract, that we're expecting this information back in regards to during the conference. I'm sure that we're willing to do it. Other questions, concerns? We have a motion, it's been seconded, Jesse.
Sorry, this one piece, and I just wonder if we handle it differently. Since it's only organizations, but, and I should have said this when we talked about it, but I just started thinking about it over the last couple days. Where we allow an organization to apply for an individual, that feels challenging, and I wonder if that's something to remove and instead decide, like, we already fund this organization that does scholarships, so let's give them X amount of dollars for individual scholarships, or like take that part out of this, think about putting it somewhere else. Like, I just think about if I'm a MEHAB and I keep getting requests like from a treatment provider to cover this uninsured person, like all of this is gonna go before other organization. Like, am I making sense with that?
So what you're saying is, and put that sentence differently. So, but what you're saying is, what you think you wouldn't wanna see is Milestone calls up and says, I need $4,000 to put somebody in residential. And so you give them $4,000 to pay for treatment. Versus, for me, it would make more sense if an organization said, we'd like to set up so that we have in our organization $10,000 to be spent on more than one person. You're saying that you're reading this as it pertains to an individual.
That an organization can
Applying
apply.
for an individual.
Yes.
So I have and I'm using a fictitious name, Frank Smith or Susie Sunshine needs money for a rehab, Milestones or Wellspring calls up and says, I need $5,000 to pay for that. Can you give me that money?
I understand that, and I think that's realistic,
Yeah.
that it probably will happen that way. But I think the original reason we actually started this conversation was that scenario, and that we did want money available for that scenario. So it just depends on if our goals have changed since then.
Well, it is, I have a hard time believing that a grant maker is gonna be able to like do the individual piece. Even like I think about the Hope Fund in Washington County, where people can do this and like it's a big process, but there's one holder, like flex funds like we do with kneecap, like there's ways around it. And I wonder if we pull this out somewhere else on the individual piece.
So I just want to clarify the suggestion, are you piggybacking on what I think has been offered by both of you, which is that an organization could apply to establish a fund to deliver that support rather than each time requesting from the fund?
yes.
Okay, I would support that as well. Because I do think administering that like one-off each time is gonna be burdensome, and we're sort of asking the organization to hold some of that administrative burden by holding a fund and distributing it until it's depleted.
So I'm gonna ask Paul, you've made the motion, will you change your motion to reflect that change that Chastity is?
I think Holly did.
Which section? Holly made the motion, Holly.
How about we just like, cause we also, I have to change that.
Yeah, we have a
So
few
we'll just say
amendments,
like, as discussed and agreed upon, with the changes discussed and agreed upon.
Well, the motion was made
Yes.
to accept the draft policy.
So we just need
And
to.
we didn't say,
Holly back to
we
the back.
need Holly to come back to say with the changes as discussed.
Wanna go back on the draft?
No, I think you can wait.
Yes, you seconded
Can I
it.
ask a quick question? So say
Who's-
a number of organizations in the state that really focus on, types of solutions, for them set up, they have resources to do it. Say they apply, we want $10,000 to have this money set aside for, say, recovery housing, blah, blah, blah. Say they run out of that. Would they, under this language, be able to then come back for a second?
Yes,
Okay.
there's a line in there that says they can apply multiple permits.
So,
Like a first.
so Holly, I need
It was a while ago.
to know if you will amend your motion to say that you would accept this draft with recommended changes. There's a couple typos that we need to change, plus that change in the wording in regard to individual. Would you change that motion?
I would like to make a motion to amend my original motion. I need to withdraw my original motion.
Yes, you do.
I would like to withdraw my original motion.
And Tess, will you withdraw your second?
Sure.
Okay, so it's been moved, it's been, the motion withdrawn. Now, do I hear a motion that we accept the draft policy with the recommended changes from the council meeting?
So
And it's been moved by Holly and seconded by Tess. And Betsy, you have your hand up.
Yeah, I do, because when you all talk at once, I hear garble, which means I understand nothing. I think I understand what the change is, but I won't guarantee I get it right. So just, I guess if somebody can help me out afterwards, it's fine. I now know who made the motion and seconded it, so that's a big help. Thank you.
Okay, and Chastity will send that wording.
Yeah, we'll get it figured out and squared away, I think.
Thank you.
So if no other discussion, can we call a roll?
Betsy Fitzgerald.
Yes.
Deb.
Yes.
Holly.
yes.
Tamar.
Your mic must be off. Tomorrow.
Yes.
Thank
There
you.
we go.
Yes.
Saw the lips move.
Maggie.
Yes.
Melissa.
Yes.
Pat.
Yes.
Paul.
Yes.
Tess.
Yeah.
Todd.
Yes.
Yes. Motion
Yes.
carries. Long time coming. All right. just love moving and grooving. All right, next on the agenda, are they on? Is HRIA on? Olivia? Yeah. Okay.
I need to apologize and excuse myself, I have to go to the memorial service, so.
I'm sorry for your loss, but I understand.
It's memorial, it was 1 year ago today, it's lost. Yeah.
In my thoughts, we totally understand.
Okay.
Here we are, we're going to talk about the prevention grant and where we are. Thank you.
Yeah, today, HRA is back, so we can talk about, recruiting the reviewers. Who's gonna do it, who's interested in it, what that looks like, etc. So Heidi, I'm gonna throw it right to you.
Okay, fantastic. I am hoping that you can confirm that you can see my slide, because I can't see you.
We can see you, but we don't see slides.
No slides yet, Heidi.
Really? All right, let's try it again.
Oh, it's coming. There it is.
Here we go.
All right. I'll figure this out someday, right? Okay, thank you so much, and I apologize for my continued lack of process. So here we are today. Thank you for having us back. We've done some really great conversations in the interim, and today what we want to talk about is what we have now renamed to the Maine Coalition's Working to Strengthen Community Conditions. RFP is going out on Monday. And so, woo, right? That was a celebratory sound, right?
Yes.
Awesome. And so we are going to have one last call tomorrow with Chastity and Liz, just to on all the little logistics to get it out the door. And our next phase is to really think about the reviewers and the process and the recruitment. So what I want to do today is just give you a quick reminder of the intended review process. We presented it a while ago, but I want to ground our recruitment of reviewers based on the process. Share a little bit about the expertise and experience we're going to be looking for, the timing, like when it needs to happen and what kind of time commitment it will be to be a reviewer. And then we're looking for your assistance in identifying reviewers. So this is what I'm going to cover right now. All right, so the review process. High level, the charge we were given was to try and design a review process that had these things in mind. That we were wanting to try and center organizations and communities with lived experience, and also recognize that we are doing so within the context of a public meeting requirement. So we had a few key questions that we were asked to look at, specifically how the MRC could maintain oversight and accountability for decision making, how people with prevention experience and or lived experience could lead the review process, and then how we could create a process that allowed for open and honest deliberation that respects grant applications and prevents reputational harm, that ensures the widest possible application pool, maintains transparency both within the process and in the decision making for the public, and that would minimize bias, given that we know that everybody in your state are connected, everyone's connected to somebody else, right? And so really the key was this balance between bringing in people and maintaining the MRC ability to make decisions. Where we landed was a two-step review process. So the first step was we had talked about establishing an external review committee. That committee would be charged with ensuring that as the applications come in, they're looking for alignment with the funding purpose. They are looking at the coalition's strengths and operations. They're looking for community engagement, and they're looking for feasibility of the proposals that come in. This external review committee
would be the ones to look in depth at every single proposal, have a conversation, do an individual rating of a proposal, and then have conversation amongst reviewers as to what the recommendation would be for funding or not. And then that would be a full list would then be forwarded to the MRC council through one of your regular meetings and public meetings, where you would, as a full group, then look at that list and look at it for the ideas of where are there gaps in funding that could be either by geographic area or by special populations, and what you know about the communities that are most impacted by opioids. So the MRC as a whole would have a different set of criteria that it would be using to look at the recommendations based on the quality and the adherence of the applications to what was put out in the request for proposals. What we have said was that we would look to see about having each application reviewed by 2 reviewers. So in this, what I'm calling the review committee, one for sure being someone externally, I'll come to that, who had lived experience and an understanding of the content of the intention of this RFP, which is about moving from prevention to addressing the community conditions that give rise to opioid and other substance use overuse. We had posited that there may be some MRC members who would like to operate in both spaces, meaning some MRC members might like to be part of the review committee in addition to being the final deliberative opportunity together. I will share with you what this means though in practice. But before I do, is there any question about this design before I move on to the practicalities?
Yeah.
Please, yeah.
I think I'm following, but wanna repeat back to see if I understood correctly. So 2 people would exist on the review committee or 2 people would review each individual applicant. And maybe maybe they're producing a score or something. And then are only applications that are deemed are all applications then going to the full council, or only like a subset of the applications going to the full council? And then just with my only other question is really with 2 people, you may not get consistency per se. And so if you can speak to how you're trying to standardize how those applicants would look at and score and understand those categories similarly.
Sure. So I jumped ahead. Hopefully you could see how I jumped to the screening and review process. This is what we had put together a few meetings ago. So the way this would work is that HRIA, so our staff, would confirm eligibility and completeness of the application, just to make sure that, yep, somebody as a reviewer should look at it, right? That's the first thing we would do. The second thing is that each application would be scored individually by 2 people. So what the idea would be, there would be 1 reviewer from the MRC perhaps, and then there'd be a community advisor. That would all be like, there's no discussion, it's just individual review. We then move to the discussion. So things that once they have been individually reviewed, we as HRIA sort of put together a report that says, here's what the numbers look like. And here are the recommendations of the individual reviewers. But then the second piece is setting up a series of discussions amongst reviewers about the applications, right? Where they would look not only at the numerical rating and the recommendation of the 2 people who looked at it, but that would be vetted in a broader group, right? And so the number of discussions, the idea is there'd be a discussion within the panel only, as opposed to having a discussion across everyone. The idea is we're going to convene a limited number of panels that are all looking at the same application grouping as a whole, with the notion that we were going to try and have just 1 MRC member per panel. It gets really wonky in here, but I think that the key thing to tell you is that the way that it would work is Stage 1, individual review. Stage 2, discussion still within this review committee. Then the ones that are at the top or of highly rated, endorsed by the review panel, all of those, that recommendation then goes to the MRC overall. All the applications as they come in would be available to all the MRC members. So should you want to see all of the applications and all of the ratings and discussion that was had by the review committee, all that information will be available to the MRC as the recommendations come to that the full council for that final decision making.
Thank you.
I hope that cleared it up.
It did, thank you.
Betsy, did you have your hand up?
I did, thank you, but Heidi answered my question while she was talking.
All right, thank you.
Thank you.
Glad to hear that. Okay. Anything else before I move on? Okay. So just some notes on the timing of what we're expecting here. So as I said, June the 15th, we are launching, which means putting out the opportunity for funding. We have a pretty full-fledged plan for how we're going to get that out, and the details we'll make sure that you receive from Chastity later. But just to note that the applications will be, well, as we say, out in the field from June 15th to August 11th. We wanted to give coalitions enough time to learn of the opportunity and then also attend some capacity building sessions. So my colleagues, Ben Wood and Brittany Chen, have a series of 3 different sessions that are planned to help coalitions or folks who are interested in applying, making sure they really understand what the work is and what the funding opportunity is to move from a focus on individual prevention to more focus on changing the community conditions that would lead to health for all. So while that is happening in July, I will be working with my colleague Hannah James and you to recruit and provide an orientation to members of that external review committee. Because starting in August, after the applications come in, that committee will have the assignment of doing that individual scoring that I mentioned. The high time will be between August 21st and September 21st. We've given a full month for that, knowing that it's just a crazy time of year. It is hard to predict at this moment what load that's going to be, but I'll show you a slide on that in a minute. It all depends on how many applications come in and how many reviewers we have. But just so that you know, in terms of calendars, that's when the application period closes and we're going to move into the review period. We then will have a series of external review meetings, again, dependent upon the number of applications, reviewers, and MRC members. But our goal would be, before we hit the October meeting of the MRC, the goal would be to have a preliminary set of recommendations, either for the October or the November meeting. So that's the tentative schedule right now. Questions before I move on?
Because council members are located all over the state, I'm assuming when you say meet, that's the availability to do Zoom.
Absolutely. All of this would be virtual. Thank you for pointing that out. Okay. Rolling. All right. So what we're looking at for reviewers. So as I said, I did my best to do some guesstimating. This might be a little bit, it's a little bit random, again, based on how many applications actually come in and how many reviewers we get. But the orientation, which would probably be about an hour and a half, self-paced because it will be online with, and then our staff would be available for any individual questions or concerns. Then there would be, as we said, you get a pot or a list of applications to review. It's all online using our Smart Simple grants management system. That will be individual. We expect that. We always try to keep that not overwhelming so that you really are able to focus, but we're thinking that could be up to 6 to 8 hours in total. So not per application, but given the lot of applications that you receive. And then we would be looking for reviewers to participate in one virtual meeting. We think it might take an hour to 2 to prep, and then 2 to 4 hours in the meeting. So this gives you just a general sense like of the level of commitment, time commitment that we're asking of reviewers. And remember, it would start the 6 to 8 hours and the 1.5 all would be sort of that end of August to the first couple of weeks of September. We're hoping we have motivated and excited people because it really is a great opportunity. And as I said, what we're really looking for are members, and I think I didn't put the slide here, but as you recall, what we're really looking for is folks who actually can bring some expertise, local expertise in what it means to lead coalitions, what it means to work on changing community conditions, and obviously who have some expertise in the substance use and opioid use realm. We started, yeah, please.
This is just a housekeeping sort of thing, but when people declare a conflict of interest, if you assign it to somebody and declare it, can you keep that on record so that we know that if somebody asks the question?
Oh,
people
yes.
we are able to safely say, yes, Deb said she could not review the following applications because of a conflict of interest. We just needed to have it on record in regards to that.
Yeah, and we can work with you on a conflict. If you have a standard conflict of interest form you want us to use, or we have one that we use, we do keep track of it all. And usually what we do is we send out the conflict of interest form along with the list of the specific applications we're hoping folks will review. And then they have that list to say, oh, I can say I have no conflict in number 1 through 3, but number 4 and 5 I do. And therefore, what we end up doing is reassigning that application to somebody else and flip them around a little bit. So
and it's absolutely perfect. We'll use your form. I'm sure it's great because we don't really have a standard form that currently it's a complicated one. But I think that works just perfectly. Again, as long as we have that list of who's declaring conflict of interest. Thank you.
Absolutely, absolutely. And we will have very good records internally, and we can work with you on whatever you might want to have available upon request. Okay?
Thank you.
Of course. Thank you for asking. All right, so we did a little sleuthing, a little thinking about who might be potential members for this external work group, right? And so the first most obvious was to think about, well, the folks who wrote, who are part of the prevention work group and who put together the report upon which we built the RFP and this proposal seemed like natural folks to consider. So I grabbed this list from that report. So that's one list we could possibly look at. And as far as I can tell, I highlighted because I think this is still accurate that both Liz and Melissa continue to be members of the MRC. And so that would mean if they were asked and chose to participate, you would already have 2 MRC members as part of that review committee, the external review committee. And ideally, we're probably looking for 3 total. These may not be the right 2 to start the pot of 3, but ideally we're looking for 3 members so that we can balance out the expertise and the integration between the external review committee and the MRC and not add a whole lot of extra layers of sub discussions that would need to happen in order to have only one MRC member at each meeting. So this is the preliminary list we're looking at. I will ask you not here in public, but if anybody has any concerns about this list, to please let Chastity know if there's any reason that you're not comfortable with someone on this list. The second was we've started looking at who beyond that prevention group might be have the expertise and experience working in coalition, working on substance use prevention, understanding what it means to move upstream and look at community conditions as opposed to looking at one-on-one intervention or prevention of opioid use. So this is, again, a beginning list for us. And again, if there's any concerns, I will be having a follow-up meeting with Chastity to like really work out the details. We have time to move on it, but I wanted to at least seed some thinking. For today, what I really want to do is see if any additional members of the MRC are interested in joining the external review committee or plant that seed for you to think about the commitments and where it is that you think you would best fit and value being part of the process. So that was my goal for today. I'm happy to answer any more questions, hear your feedback, gauge your level of interest.
If we have suggested additional members, should we just reach out to Chastity?
Yeah.
That would be great. And because of the potential for a conflict of interest, I think having a broader pool serves us well. Yeah.
This is Tess in the room. I know with the list of members that you proposed, I don't think there would be a fair way in public to disclose whether or not any of those individuals have lived experience. But I would love to see maybe off out of a public setting, making sure that we have some folks that have, lived in communities and maybe even folks that have been a part of communities that have successfully used coalitions to make things better. Because I think every decision that we make, there needs to be people with lived experience at the table.
Love that. And thank you so much for both being attentive to confidentiality and the importance of having people who have the experience that you've just mentioned. And you all are much better placed than we are to know who those individuals might be. But that would be our goal, is to try and have folks who can bring that way of understanding in looking at the applications that are received.
And I would ask council members if they're thinking about it to go home this weekend and think about whether they want to be part of it. And if they're not willing to say, yeah, I'll do that right now, would you please contact Chastity on Monday and let her know that you are willing to do the grant reviewing.
Yeah, and I really appreciate that. Do think about it, because I know that the timing, both the time of year is a little bit challenging. And while it may not look like on paper that the level of commitment we're asking for is huge, we also know that many of you are probably already balancing a whole lot between your family life, your work life, and your volunteer life. So I know this could be a big lift, and it is important that we have people who have the ability to take this time, and we also know that no matter what, you all will have the final say.
Hey, this is Melissa in the room. Can you just confirm, did you say you think the ideal number is 3 total? I'm trying
That was my, yeah, so Melissa, that is my thought. Just on the pure logistics and in terms of our capacity to hold, because what that means is 3 distinct reviewer panel conversations. And so like herding cats to get 3 times on schedules. So beyond that, it becomes a little bit more complicated, and it's more than we put in our budget to you. So 3 would be ideal. If that's it, as long as that feels right to the commission.
I think the thing that I'm just wrestling with is if 2 of them are MRC members, what those panel meetings look like in terms of being public meetings or not. So that's just what that's what I was thinking through, if it makes more sense to have one MRC member and 2 community advisors for that reason.
Oh, absolutely, Melissa. Thank you. So each of the panel conversations can only have one MRC member.
Okay.
Right. And that's exactly right, which is why we would need each MRC member, right? We would indeed need to have a separate panel conversation. So if you have 2 MRC members, they're in different panel conversations. 3, that means 3 conversations. 4 means 4 exponentially.
Okay.
I hope that made sense.
It does. It's helpful just I think in terms of considering that balance.
Absolutely. And our goal ideally would be to have at least, 1 MRC member and 2 community advisors looking at each of the applications. Again, what we feel like that does is it balances out perspectives, it levels some of the potential biases if we do that.
Thank you.
Thank you. Any other questions? Paul?
The RFP is going out tomorrow.
Yes, it is.
Do we have a?
Not tomorrow.
Monday.
Monday, okay. Do we have a website we can refer people to?
You will.
Yes, you will.
When things are ready and live,
Yeah.
yes.
So be patient.
Yes.
It's a
Yeah. If you want, I can tell if you have
phone.
time, but I know you're really tight. I could tell you just all, in a nanosecond, all the materials that we've put together for the launch.
Great, thank you.
All right. No other questions. Thank you very much. We look excited about moving this forward. Thank you.
All right. Thanks for the opportunity. Love working with you. Take good care.
Thank you.
Thank you, guys.
All right. Thank you very much, everyone. All right. Finally, not least, staff reports.
Which is awesome because we didn't actually put any reports together because we knew today was so packed, we didn't think we'd get to us. So.
Oh, sure, so we got you off guard.
Yeah, there are a couple things. One, to know next week is when Elizabeth and I will be in Denver for the conference you're sending us to, so I'm only around Monday. Elizabeth, unless she's been able to change her flight, will be around Monday and Tuesday, and outside of that, be radio silence.
And remember, because they don't have a cell phone, they can't get their state email on their private phones. Pet peeve, I'd like to get that problem solved, but they can go on their computers when they're around and whatever and get their email. But please remember that her response time is slowed because she can't have the state email placed on her private phone.
Well, maybe it would just be better for her to be off. Sometimes I wish I couldn't access my work email from
You
my
frame
phone,
it only
so.
But you don't want it on your personal phone because then
Right.
everything is
Correct.
available, so.
Yeah.
All we want is just a phone, so when she is off away on
Just be in
business,
Denver.
she can access it on business. But anyway,
So that's why
I can't afford a telephone.
Huh?
We can't afford a telephone.
it's just one of those little barriers that we keep bumping into. We would like her to have a phone, but we keep getting a barrier, so I'm gonna leave it at that.
Why can't the MRC as part of the staff financial support put this under staff equipment and pay for a phone and a plan?
Correct. We have put those requests.
And why is it not an MRC voting decision?
We can't get the permission from each agency.
Because it would be connected through like IT and stuff, so there's still.
It's state email.
Some pieces and.
Got it.
But we could get a phone number through if we created it as a reimbursable line.
Yeah, but you
But
cannot
it would
put,
not include email.
it could
But
not
it would be a
include,
number.
it would be in a,
That would not be
Yes.
stopped.
Would it help if somebody in the AG's office got 15 individual phone calls saying, hey, can we get Chelsea a phone?
I will not be part of that conversation, but you're all welcome to do whatever you'd like to do.
Well, I was gonna make the statement that if the connection to the state is prohibiting the council from being able to operate, then that's a conversation that needs to be had somewhere.
That is absolutely correct. And again, we will pay the bill. It's not like we're asking the state in any way not to not pay the bill of the phone. It could come out of our allocation.
So perhaps we could put equipment back on the agenda when Brendan's here.
Let's do that.
I like that.
I'm for that.
You can assign it to me. I'll ask the questions. I don't mind.
Good, you do that. And Chastity's on a panel at the conference.
Oh, that's exciting.
What is the conference?
It should be, it's an honor, it's the Opiate Settlement Conference, so from every state, and she's been asked to serve on a panel of like programs, but you're sort of an outlier, not with.
Yeah, last minute panel that was already part of it, and that was a last minute ad that has the different sides of it, so a lot of advocates and stuff, and I'm one of the weird people that have been on all the different sides, so coming to.
That makes you perfect for the panel though.
Yeah.
I think weird is the wrong word.
I'm an outlier.
Just an outlier. It's not like.
Yeah, the timing is
More,
not ideal
you are
because
more
the-
qualified.
my flight, I have to leave the conference a little early Friday for my flight, so the panel will actually be the last thing I do, and then I'll be out of there immediately. So,
And then, because of her job, Tess will also be there, so we'll have 3 members from our group being there to be able to report back about what other states are doing. Anything else, Chastity or Elizabeth?
York County, finally. So Brendan has gone through and like he's really taken it on since their county government redlined a lot of our stuff because we haven't operated with like government in that way. Everything else has been organizations. So, but like very differently. And how they're using it is different than our other stuff. So there's finally a draft. Yesterday, Brendan sent it to them to review. We still have to identify on our end, like the start dates and stuff, but I asked Brendan to don't give him like, this is our start date because we know they're gonna come back with some stuff because of course, that's part of the negotiation. So once we do that, we'll give start dates, but at this point, once we're after July 1, I think we can move things pretty quickly. One of the challenges with that, if you remember, because they're buying kitchen equipment, whatnot, so it was identifying deliverables, because we still want to see meaningful data, not just you bought kitchen equipment, this contract is done. And there was a clawback provision in there, so if the kitchen is used for non-allowable uses, they can bring it to us to approve and they can do so 10 times and like pay 10% back to us. They were the ones who asked about a clawback provision to make things so it suits both sides.
So for example, if they wanted to cater a fundraiser through their kitchen using the kitchen equipment that we purchased that doesn't actually benefit the community or the people that it's intended for related to the opioid epidemic, our money shouldn't be used for that and can't be used for that, so that's the clawback. So they would have to pay us back for the use of what we purchased because they're using it for something other than what they asked us for the money for, if that helps.
Yeah, and then a provision also to be operational, providing those services for, I think we put it 5 years after the end of the contract, or 5 years total. I don't remember how it was, but I'm looking at it now, my computer died. But there is a provision in that, so that way if something happens, the whole facility closes down and they're no longer doing that, each year, like it drops 20% of what they would have to pay back. So like
depreciation.
Yeah.
It's just small and like it's so far down the line with the lawyers that like let it go where it needs to go, and if that's what they agreed on, that's great. I just feel like sometimes our left hand and right hand struggle. So like a kitchen equipment depreciation for a use for a fundraiser does not limit the use for these other purposes unless the fundraiser is dominating the time, right? And so when we think about our other goals, like community conditions, bringing people together, things like that, I would love for this equipment to have secondary follow-on impacts where it's bringing communities together and creating support amongst communities. So I get it, the lawyers are down the road, let them finish the road that they've gone on, but I think sometimes our black and white interpretation can run counter to some of our broader odds.
I think they can use it for recovery purposes. What they can't do is let the local PTA to come in and use the facility.
But the PTA may be raising money for special needs, which then go into the schools in a way that works for our prevention goals. I mean, I think I wouldn't want them leasing the equipment out to a restaurant for a life of time, but anyway, it doesn't really change things, because the important thing is getting it over the line, and it sounds like we're real close to that. But sometimes I wish we could be more flexible.
For the most part, we can. Like, we actually can in things like that. This has been like a real challenging outlier for a lot of reasons, so.
Sometimes I wish we could just get a cell phone.
It's never easy, it's never this little path.
Open that there, Tom.
Okay, any other things?
Can't let it go.
And as we kind of alluded to that, this is our last contract from that batch, so that'll be exciting when that's over the finish line. I also just want to recognize publicly and thank the OED Finance Department, especially recently, has been more than gracious with us, extending deadlines, rushing things to get things processed for deadlines that they've already extended for us. So everyone who has put in work for us, just thank you. And there's money available to providers as quickly as possible. Again, I know it hasn't always been as fast as we would like, but especially recently, a lot of people have helped us out. And then just housekeeping. You all have done a great job getting agendas to me. If you can get them early, that's always really great. I have to get them to Katrina to get them on the website. And you know, she has 1,000,001 other things going on. So anytime you can send that to me early, that's always helpful. With minutes, I love the initiative people are taking to like send them out directly. If you can send them to me first, just so I can review them. I like things in a certain way. And so sometimes I like to make little changes. Also just formatting for accessibility, anything like that. If you can just send them to me first, that's appreciated. I think that's it. And one last thing on minutes. Again, love the attention to detail. You don't need to transcribe a meeting. We're just kind of looking for like, what was this action? What was the general description or discussion? Was there an action item or was there a vote? Again, I love that some people are going really detailed about me. We're recording, so we don't need.
You need an executive summary, not.
Can I make a suggestion? It sounds like you have a preferred format. Could that be shared with the folks who are taking and sharing
Yes,
minutes?
we can share that. Yeah.
Okay.
Yes. And Maggie has raised a point, we're looking into it about whether we can use some type of like online transcription services. It's just a little, Zoom wants access to every file on your computer, which we don't love.
Yeah.
So looking over into any alternatives to that, because again, we're very thankful for the work you all do to help make those notes available, but we also know can detract from your availability or your ability to participate in a meeting. So that balance as well. So what can we do to help make that job easier for all of you? So looking into that as well.
In the vein of gratitudes, I also just want to say I appreciate that the materials for the meetings have been coming earlier to us, and I really just want to say I know there's a hustle to do that, but I appreciate the extra time to actually review things and come prepared. So thank you.
Thank you guys for holding away the Christmas absence.
Yeah.
I just want to say, I think we're done with business, but want to say it really has been a productive meeting. We've got the prevention grant going out on Monday. We have a proposal for the getting money out faster to the community. What else did we do? It seemed like we did the school funding today. It was like this great day for work getting done. So I appreciate it. And we're actually getting out a little bit early. Paul?
I hate to do this, but
never mind, you take back early.
Miles for public comment today. So
the council gave, we won a grant for, we chosen for a grant of $500,000, but that's not gonna get it open.
No.
And, I'm really torn because we've worked so hard to develop this, urgent, funding thing. But now we've given $500,000, but it may just dissolve. And what are people's thoughts on that? That's hard, it's hard. And there's a need for that. So, but on the other hand, I'm not sure that it's viable.
So Miles has decisions to make. He was given the money to get a project. In fairness to him, he said he's out of money, but he's not out of ideas. And he's also applying to other grants. So in fairness to him, I think for me, you let him see it. He knows where we are. If he needs help with something, he can certainly reach out and do that. But out of respect for him, he's done a lot of work. And he's got some things he has to make decisions on. And with community partners, with other grants that are available, he's got work to do with getting it licensed. And so those are where he is. And no, I hate to see that building go vacant. I would hate to see that an area that lacks many services. It is in Aroostook County, which is rural. But I think for me, out of respect for Miles, we have to let him run his course, and he knows how to ask for help.
He did reach out asking the MRC to consider giving him another grant, $250,000.
So what are you originally applied for?
And,
So what do you originally
yeah.
apply for? Yeah.
So I just want to put that out there. I'm very torn about it. And I don't know what people's thoughts are. You don't have to say it right now, but just wanted to open it up.
I think he has to put a formal request in. That's what he's requesting. We can have the council discuss it, but I don't think we can, for me, again, as I said, I can't put words in his mouth. He's got to be able to say what that request is.
Yep.
What exactly is the money going for? How much does he need? When does he need it? Those are the questions. Then the council can have a discussion, whether it's he's gonna have to wait till the next grant cycle or whether they will do that. But that's sort of where I am, but I'm only one person on the council.
Okay, great. Thank you.
It would be, it'd be okay if I talked to Principal Shea.
Sure.
I talked to Miles the other day, and I know what his request is, and told him to do a formal request. How we handle that is not done and recommend it. You can do public comment to at least lay out where you are. You can't make the ask. So he knows that. I appreciate he drove down here, and I wish he wouldn't have drove down here for 3 minutes.
Yeah.
Because I feel really bad about that with how far it is. So I have shared it with them, and if you want to share back.
I will share it with him also. Thank you. I appreciate that they recognized before that.
Yeah.
He's free to use.
He's a good man with a large heart. Anything else? All right. Well, have a good weekend. I will see you July something. It's the 8th. Nope, 9th. All right.
Can we?
July 9th, we are officially adjourned. Thank you all. Thank you very much.
Oh, you.
Please sign out. If you sign in, sign out, please.